Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
Good morning, ladies and gentlemen. May I request all of you please take your seats. We are going to start the conference. All those who are standing behind, please take your seats. Can we stop the serving of tea, coffee for some time? Please take your seats. We need to start the conference now. It's already 11:10. थोड़ा बिठा दो लोगों को. Those who are standing next to the pillars, please take your seats. Please come inside. Those who are standing behind also, please come inside. Good morning, ladies and gentlemen. A warm welcome to the third Bharat Digital Care Summit 2026. We have come a long way on the digital healthcare. So before we get into the discussion, let's take the blessing from the Almighty. I request all the inaugural distinguished speakers to join me for the lighting of lamp. Dr. Deep Goyal, Dr. Rashmi Gupta, Mr. Arun Goyal, Father George P.A. will be joining here. Father Dr. Santosh Sebastian and Dr. Rajiv Chibar. Please join us for lighting the lamp. may I request all the dignitaries come on the stage. Dr. Deep Goyal, Dr. Reshmi Gupta, Father Dr. Santosh Sebastian, Mr. Arun Goyal, and Dr. Rajiv Chibbar, please come and take your seats. Ladies and gentlemen, a warm welcome to the third Bharat Digital Healthcare Summit. You know, we started this digital healthcare when we used to stand in the queue in the Safdarjung and AIMS ki meri parchi laga dena. So that parchi, then that person goes, when the doctor comes, ulta kar dete hain, kyunki jo pehle aaye wo niche hota hai to ulta kar dete hain, then becomes your number. Then we begin with token system. कि आपका टोकन मिलेगा सुबह 6 बजे से लेके 8 बजे तक, फिर आप 11 साढ़े 11 बजे आ जाइए. Then we started non-digital numbering कि वो नंबर आएगा तब जाना है. Now you have an app for a doctor for an appointment. So look at the way we have come all the way from पड़ोसी का फोन, then PCO, then pager, then mobile, now digital. So ladies and gentlemen, what I wanted to say is we have put on a lot of efforts to put the health into the digital. Now suddenly AI has come. Now I don't know what AI is going to be there, ethical or non-ethical. I was talking to Father Dr. Sebastian on that. We all agree with AI. It's a big question. But somewhere AI is already in our life. Day to day we are doing it. We see a lot of politicians, duplicate AI comes which is dancing with this and that, and it's already there. How the AI is going to help the digital health, I'm sure. We have experts who will be talking on the AI as well, what AI is going to bring into the health industry. But I personally still feel that AI will not replace the doctor. This is my personal belief. This is my personal belief. Doctor is a doctor. We can do a lot of video calling, this, that, 5G, 3G, 2G, 4G, now 6G. Because next our conference is on 6G in May, which we are going to launch it in Delhi. So we have come a long way, but is AI going to replace the doctor? Or for that matter, robotic, are you going to replace the nursing system? The nurse is a backbone of the hospital. The doctor comes, check the patient, rest you hand it over to the nurse to manage it. So will the AI or robotic nurse will take care about that? I still have a big question on that. A human touch is a human touch, end of the day, whatever it is. So having said that, don't want to take much of a time giving my own perceptions about the digital healthcare. But no doubt, we have come a long way in the digital healthcare system. Now the villagers are reaching to the doctors. Doctors are reaching to the villages. But still, somewhere that vacuum is there. We've not been able to serve this 140 plus crore people in this country. We have a lot of hospitals, we have dispensaries, we have mohalla clinics and all, but still the rural people are still left behind. That somewhere I believe that digital health will help, but again, a human touch is a human touch. With that, thank you so much for all of you to joining here. Now, I would like to invite Father Dr. Santosh Sebastian to address the gathering.
Good morning to all of you. Going by the panelists' order here, I thought my presentation would have been at the end. First of all, my heartiest congratulations and appreciation to Shashidharanji and all the organizers of this health summit and all these distinguished panelists and all of you distinguished dignitaries present here. We are not big or small in comparison to each other. We are equally important because we are equally concerned about a particular common objective, that is serving the human being in its best manner, but in the ethical manner. Now I am given about 10 minutes or so. You can give me a warning bell or something before that one, and I would not do injustice to by taking away the time of others. And and I do not also see it as an academic presentation, but I, as a small little person here coming from a small hospital in Gorakhpur, I would like to present on this entire theme only a few concerns and a few of my own personal impressions. That's all. Up to you to agree or disagree, up to you to just, if it helps you reflect upon, I would consider it myself that, it is fruitful. Okay. It's by way of a few PPT slides I have presented. This one, the theme given is, as you know, that one, building trustworthy AI ecosystems for the future of healthcare, integrating artificial intelligence with a human-centered care in the digital health era. Good. I stand here on behalf of RUPCHA. RUPCHA is the regional unit of CHAI, Catholic Hospital Association of India, as a mega network, pan-India network. And here I express also my heartiest thanks to very Reverend Father John Brito, the Director, President of RUPCHA. And thank you for partnering us here. We have, let's proceed to the second. Okay. So, we have about 235 healthcare units, including NABH hospitals and all we have mentioned here. And 7 states in North India and 3 UTs is here. And the capacity and collaboration, what we have mentioned, so I'm not sticking on to that proceeding. Next one, the question is that when artificial, we are all focused now on AI. But have you ever thought about, or have I ever thought about, what is natural intelligence? That is my own intelligence and your own intelligence. Since I am a priest and since I trust and believe in God, I would say that one, God-gifted intelligence, because man is created in the image and likeness of God. That is the core crux of all our ethical approach and the moral consideration, you know that. Okay. So I'm not explaining anything into that one. So you see the smiling side of that beautiful lady here and the machine side of that one. Okay. Then the Hippocratic oath and the principles. I'm reminding myself first and others. In the process, in the course of our running after all these technologies and developments, and sometimes we become faceless, have we forgotten this fundamental fact? Recently, I had a program in my hospital and the nursing college on the World Health Day. I told them not to embarrass them. Don't raise your hand, raise your hands in your mind, I said. How many of you know by heart the Hippocratic oath or its key principles? I know if I were to ask us also, the response would be mixed, right? But then let's never forget this. And in that one, you see, the ethical foundation is the core principle. Do no harm. Opposite, you know, the business aspect when it comes, okay? The beneficence non-maleficence and autonomy, justice, etc. You see, centuries back it was thought about. Centuries back. So, it reminds us of the core things. Understanding healthcare, holistic perspective. In this model I have built up this core logical flow. Physical care, mental well-being, socio-spiritual support. That is very especially in India, the spiritual cultural support. Rest you can read for yourself. I'm proceeding. Healthcare scenario in India. Again, let us never do or attempt anything by forgetting the roots or the context. For you to create an impact, however best something is or however worst something is, you should have a contextual understanding. The patient, who is the patient? We refer as a patient, okay, nursing staff, HODs, doctor. Who is a patient? Patient is a human being. Rest of the things I have given. And inherent worth and right to receive compassionate, respectful, and person-centered care. A patient is not a faceless thing left to the mercy of technology or left to the mercy of the hospital management or left to the mercy of a pharmacist or a doctor. It's a person. And also, so to say, biotic, non-unbiotic like, okay? So, complementing healthcare and AI, a collaborative future. Already our traditional or whatever method, clinical expertise, then AI how? Data analysis, pattern recognition, predictive insights that support diagnosis and clinical, etc., etc. But then, the complementing completion happens with the human touch. Practical possibilities of AI in healthcare. Am I exceeding my time? Please correct me. Okay. Diagnostic support. Very much. We should all be not just worried and reserved. That is why in our schools we teach our kids the best of the science. Is it not? And the reason and faith, or faith and reason. Reason here, the what we call the rationalism, stimuli, critical thinking, and scientific engagement. That is a God-given thing, not just one-sided. So we must be always open to the changes that are taking place in our world and the demands they make upon, but without compromising on the core values and objectives. So there are very many possibilities which would be offered in this one. Then administrative efficiency, you know that one. Earlier we used to manage by hand or manually. Today we can be multiple taskers because of the help of the technology, right? And we can reach out also. Then ethical risks of AI. This is the focus point of logic I have built up this one. Being open to the technologies and science, are we forgetful of that one? So the bias and discrimination, algorithms trained on data sets may perpetuate health disparities. My one question in reflecting, in preparing this one was that one, would this AI-assisted data recognize, distinguish between a poor child who has not eaten for 2 days out of poverty and a child who has overeaten because of his papa's better earning, and when they come to the hospital for a checkup or test or whatever, or when they meet a doctor, would we be able to, the AI or anybody will be able to make? This is a daily reality in Indian, and we are Indian citizens of Bharat Mata, is it not? And therefore we have this disparity, urban, rural, poor, rich. Then the privacy concern. When you throw myself, my all data you have collected into this, what we call AI systems, who am I becoming? And you would be defining me perhaps only on the basis of those data. That is why I told the patient is a human being. AI in healthcare, Indian context and human connection. In Indian context, you know that one again, let me tell you, in my hospital, that is based on my experience. Once it was for the highest dignitary of our nation, my hospital was a medical emergency center, you know, because of the confidential, we cannot reveal all these things. One. But then I say in my interview for new doctors or whatever, or a staff member, I say that one, no compromise on values and human dignity. Here, even a sadharan Vyakti or a bhikari bhaiya, that's I use the term, as a human person and also the highest dignitary of this nation will have equal success to this. We don't go for, and then humorously I say, in Fatima Hospital, Gorakhpur, the top management looks at the face of the people, not at the pocket of the people. Just humorously, I'm reminding you all. Then economic barriers are the emotional and spiritual care. This is one thing with, you know, that when even in ISRO, before launching the best of the satellites, our best of the Indian scientists have developed, you know, they take recourse to prayer, is it not? Have you ever noticed that when a patient is admitted in a hospital, the relatives and attendants, how much they seek prayers and etc. When we go also, what we say, giving a pat. Yes, don't worry, God will take care of you. We will take care of you. These things we cannot forget. The emotional and spiritual dimensions of care. This is a big question. Can, suppose one of you here, fathers, I mean the parents, you know, can your loving emotional touch when your baby cries, can it be substituted for the touch and care of an AI-led guided robot? Simple question. So, and in today is a scenario where individualism, interferentism, everything is there, and we become usually strangers to each other. We must ask this question, very especially the focus of emotional touch and care in the medical care, health care area. Time is up, showing. AI, dignity and healing in balance. We can read for this one. So, I wind up here, my time is up, and these are some of the reminders and concerns I have expressed, not as an expert, but as just as one among you who is in the service of healthcare for the human beings. Thank you, God bless you, and all the best.
Thank you for sharing the AI in healthcare. As he said that human touch, you know, sometimes the ladies are happy with the robotic cleaning at home. You just switch on the robotic cleaner. By the time it comes and cleans back, you can easily watch the movie or something on the Netflix. But here, the robotic will not have that touch. That's what Father is saying. Having said that, we move to the next medical doctor, who let's see what she has to share on that. Ladies and gentlemen, put hands together in welcoming Dr. Reshmi Gupta, Managing Director, Flex Hospital. Madam.
Okay. So a very good morning to all of you, all the dignitaries on the dais, off the dais. And I really acknowledge the Bharat exhibitions for such a wonderful event. I think it is the third event we are coming on. Yeah, so year on year we are discussing how we are progressing in AI, how we are progressing in healthcare, and what best we can do to expand it further in our scenario. of health. So I think in our scenario, this is the crucial point, and this is the very sensitive point which we should focus on and we should discuss on. So in the shortest time period, how can we reach to those needs at the earliest? So I see AI in that scenario only. How can we meet the needs of the people? How can we connect with the people who are not at all aware of their health? And even many of them in Indian scenario, we can say not even aware of what facilities do we have or how the healthcare has progressed. So it is really a very sensitive issue to discuss how can we do that and how can we reach to those people to make them aware and make health available to all of them. So as we do in Indian scenario, we say aging is enhancing. So even in tier 1 cities also, we need healthcare at home. So palliative care, in which the AI can play really a marvelous role. Because in these days, our life expectancy has increased around 80 plus in Indian scenario. At the time when we got the independence, it was 50s. Now it is 80. So age-related diseases have increased. So disease burden has increased of the lifestyle diseases, cancers, hypertension, diabetes, and their complications. So it is a collaborative effort. How can we reduce the hospital burden? We can see it in this way. If there are some chronic morbidity diseases, if there is some cancer patient, he needs at the end of the years, he needs the palliative care. So for the person whose relative is that, every time it is not possible to keep the patient in the hospital. For the patient also, it is not possible to be there all the time in the hospital. So he needs a personal touch. So with AI-enabled devices, we can provide them a good home care, which is very important. We can spare the hospital beds, and even we can improve the patient's experience as well with this. We can support the families also with this. So what I see, it is a very huge scope and a very collaborative and reliable interconnect between the doctors, between the staff, and between these modern technologies. How can we use them to make it grow further? How can we reach to all the people? How can we reach to every person of the society? How can we enable them to do more and more to the health? Even if we talk about the hospital setups also, so as we also have in our hospital the AI chatbots, so that how can we do primary appointment system by the AI chatbots only. Whenever there is a need that they need some further support or they need some further information, then only a human person intervenes. So that we can optimize the human manpower as well. We can empower them. We can utilize their competence in a better way, in a more revolutionized way. Even as we see in diagnostics AI has done wonders. So it is not that has replaced the doctors. It will never happen. And I think we should not discuss this as well, because it is creating a lot of confusions among the people. Yeah, AI has come, it will be, or the robotics has come, or robots have come, they will replace the nurses, or the AI in diagnostics will replace the doctors. It will never happen. But if we rather discuss more on how can we correlate with them, or how can we make them to work as a team, that rather can create wonders, what I think. If a doctor gets information, or doctor gets all the diagnostic reports with the help of AI, if it has created some inference, the doctor can use his brain to make it more refined and to present to the patient. So he will be getting more time to connect with the patient. So it is just a support system, but we can use it very meticulously and very judiciously to help the patients, to help the society. Because in these, we cannot expect that the vision we have, we are developing and we will reach this 1.4 billion population, and we can give them the healthcare at the minimum time period of time. This is the only way with the help of AI we can start that and we can do that. But it appears that it is possible if we can collaborate with all the systems so that we can reach the far rural areas and the people over there to provide them a good health and rather to make them aware of the healthcare system, which is at this point of time is missing. So I see AI in healthcare as a very good support if it is used judiciously, rationally, and ethically. So we all have to come together. Government is doing very good, and the people like this are doing really good so that we are getting aware, more and more aware of what AI is doing in healthcare, what new gadgets are coming into, so that we can make them enable in our hospitals, in our settings. How can we make best use of it? So this all is really very important in our scenario to grow ourselves, to help the people, and to help the society as well. In hospitals, even I see in my hospital as well, our lab is totally automated, but pathologist is there. And the collaborative result what AI is creating, the pathologist is using his brain and is presenting to the patient. It is not that AI is directly connecting with the patient. So it is my request to all of you so that we should discuss AI in one step further, that how the doctor and AI can connect, how doctor and AI can be used more efficiently in predictives, in cancer predictions. It has a very important role in cancer predictions, in whether we can have gene analysis, and then we can predict how the cancer can develop, how the care for cancer patients can be individualized with the help of AI. I have done for my father as well for this. How can we use targeted therapy and how his gene format, how his gene profile is fitting with that medicine. So this is something very important where we should work on. And it will really, really help us, and we really help the people, because in these days everyone is professional. Both the members in the family are working. They have elderly parents for which they need care, and if there is some terminal illness, they need palliative support at home. They need palliative care at home. They need ICUs at home. So these are some of the areas where we should work, and definitely we can create wonders. We can support them very well so that their mental health as well as physical health can be benefited. So with this, I really thankful to all of you that you have created such a platform and people have spared time for this so that we can really take healthcare to a next level. Thank you, really. Thank you so very much. Thank you. Thank you.
Thank you so much, Dr. Reshmi, saying that AI support can be taken. That's something word which has come. So AI is not going to replace the doctor, but we can take the AI support for the healthcare system. That's a beautiful word she has brought in to this conference. Ladies and gentlemen, let me bring a CIO and a director who should be sharing more on AI and the digital care health. Ladies and gentlemen, put hands together and welcoming Mr. Arun Goyal, Director and CEO, Sir Gangaram Hospital, New Delhi. Sir.
Good morning, everybody. Thank you, Dr. Shashidharan, for arranging this beautiful forum and given us the opportunity to share the thoughts on the digital initiative on the AI. Is it okay? Thank you. So I heard Father saying about the AI implementation into the hospital, where his concern was that human touch and the emotions cannot be replaced, AI cannot replace these emotions and human touch. So is the Dr. Rashmi. She said that operational efficiency can be achieved using the AI into the hospital operations. So I'm coming from the Gangaram Hospital, where we have more than 50 specialties working into the hospital. We are almost century-old hospital, started in Lahore back in Pakistan, and then post-independence we started in India in New Delhi at Rajendra Nagar. So it's an old legacy we are carrying. So this is about the hospital. So far as the digital future of the healthcare, I would take it in a different way. When people talk about the AI and the replacement of the manpower and the people, while AI get implementation into any of the area, not only the healthcare. You know, any technology since the beginning of the human civilization came to improve the life. When early in the Stone Age, we started having a machinery or equipment or tools to improve our lives. We didn't have that much of workload and the pressure on our life to create or improve the productivity. We introduced machines. We thought that we will be replacing the labor. But on the contrary, you see, there's a scarcity of the labor into the industry to produce the products in the industry. We moved on. The electronics era came in. We invented electronics. We moved on, we invented calculators. We came to the computers. I recall my early days in my career when we were implementing the computers into the government or into the corporate. There was the buzzword, there were the statements, there were the sentiments across the unions, people, that these computers will replace and take away the jobs of the people. Nothing happened. And so, things improved. We came with the softwares. We started improving the system. Computers kept on improving. We started with the 2 MB RAM computers. Today, 2 GB, 2 TB. We are moving into the petabytes, zettabytes. So what is this improving, and why every time this comes that, these technology will replace the human being, emotions, etc. And we are now talking about the AI. It will not stop here, as Shashidharan rightly mentioned about it. We will be moving into the next AI version also. We already started talking about the VR and AR. So where are these steps and where are we moving? We need to think about it and understand it. Initially when we created the technology, we achieved it, we created the tools. So by creating the smart tools, we improved our efficiency of doing anything in our life. So we improved those tools, and then those tools became the machines. And those machines can then produce more products into the system and improved our life. Then when this digital world started and these computers initiated or introduced into our life, what did they do? Computers only addressed the processes in our life. Whatever was being repeated processes we were doing, using the computer, we improved that process and we hand over these processes to the computers. That's how our efficiency improved. And simultaneously, our population across the globe were growing. So need of the products and the outcomes were required. So we achieved the most output. And that is what we achieved using the computers. So all repeated processes got expedited and we achieved more output. So now in computers also, we kept on achieving the efficiency by improving the microprocessor and the speed of the processes. So we wanted everything happens in no time. In a jiffy, we want everything happens in no time. That's why everybody wants that, they should be having a Wi-Fi, they should be having a mobile, and everything happens in no time. If we recall our early days when we were standing in queues in the railways or in the bank to draw the money. So those were the days are gone. Now sitting here, we can transfer our money attending this conference. We can book our tickets, flight tickets or railway tickets sitting here. So these are nothing but the processes. So we achieved the process. Now what AI we are talking about? So AI is nothing but the next step of the processes. Now we want to win the data processing. So what is AI doing now? AI is doing nothing but they are smartly processing the data and giving us the outcome. So with the computers, we achieve the processes. Now AI is taking us to the next level and giving us the decision based upon the available data. So whatever data we have, we provide it. You know, there's a saying in the computer and the digital world, junk in, junk out. So if you don't have a proper data available, you will not have a proper outcome. So you have to have a hygienic, standardized data to achieve a proper outcome. Then only you will be able to achieve a perfect AI implementation. So where to implement the AI? Where you have a proper data available, you have an appropriate data consolidation happen, and then you want to achieve outcome out of that. So let me come back to the healthcare. So in healthcare, what data we are talking about and what AI we are talking about in the healthcare. So I take healthcare, particularly when I talk about the hospital, I see hospital as a 3 pillars from the operation perspective. So in the hospital, we have a patient as a 1 pillar, which we need to, or a patient as a 1 bucket where we need to pay attention to. Second is clinical, the clinicians, the consultants, the doctors. That is the 1 area where we need to focus upon. And then the back-end operations, which supports everything. Be it human resource, be the finance, security, this, that, blah, blah. So these are the basic 3 operational pillars in the hospital industry where we need to pay attention to. So when we talk about the patient, what is the data sitting there where we can implement the AI so that patient get benefited? So when patient comes into the mind first, what is the first touch point for the patient when he thinks about the hospital? You and me are not thinking about the hospital apart from the job. We are enjoying here sitting and hearing and sharing the view. We are not, nobody is talking about the hospital. But yes, if you are in a pain, if you have a problem, first thing will come to your mind about the hospital or the clinician or the clinical or nursing home, whatsoever it is. So first data which you need to address your pain is list of doctors, availability of the doctors, and maybe the hospital or nursing where you can access that. So if you have that data available, what will you do? The thing which comes to your mind is, suppose there is some problem with you, what comes to your mind if you have all these 3 data sitting with you? Which specialty should I consult? Because I am not aware, I have some pain, I have some weakness going on with my body. I don't know whether I should meet a physician or I should meet some rheumatologist or I should meet some neurologist or there is some problem with the cardiology. Because I don't know. So I need to know, somebody should help me out to direct me to the exact appropriate consultant or a clinician. Then there are n number of consultants, n number of clinicians available. So who is the right person for me where I can go and get myself treated? So I should have that rating available. I would put the analogy like, Swiggy, when we are using the Swiggy, we want to have an order of some particular food in the night. What we do, we go by the rating, we have options of or different restaurants, we have different type of cuisines or food sitting there, we select one and order one. If I have that option that, okay, these are all doctors, those who will be able to address my pain, and these are available in these hospitals, and these are the rates, based upon my affordability, I'll be able to select it and go ahead. If someone helps me this, on a click of button. That is AI. That is the first AI implementation which we can do in the patient area. We provide an AI-based appointment into the hospital or into the healthcare, where we can help our patients to reach out to the appropriate clinicians, appropriate specialty, in an appropriate time, in an appropriate affordability to the patient. We have clinicians in the hospital, those who charge 3,000 rupees a OPD, 2,500 per OPD, 2,000 rupees OPD, 1,500 OPD, and free OPD. So based upon my affordability, I will select accordingly and move on. So the AI agent or somebody physical person will help me out, sir, go to this place. These are our rates. Please let me know what do you want to go with. So this is the area where we selected, okay, we put the AI chatbot, like Dr. Rashmi was saying that they have that type of chatbot. If that is helping the patient in this manner, your job is done. Then, okay, you got the appointment. The patient comes to the hospital and say that, okay, like he was mentioning about the queues, the tickets, the tokens. Patient should be aware, the patient should get a message from the hospital or the AI agent at his home, sitting at home, that you need 1 hour travel time and there will be a queue. There are 10 patients sitting out there. Doctor is in the OT, but he'll be joining there in the OPD. You need not to wait there. Please start after 15 minutes or after 30 minutes so that you reach there in the hospital at time, and then and there itself, your door is open and doctor is available. The more frustrating for the patient is already in the pain. He goes to the hospital and doctor is not there because doctor got an urgency into the OT and doctor will not be available, and your appointment gets postponed. So this type of things can be helped and assisted to the patient using the data available. Pre-informed, well-informed patients, half pain is gone. Patient has seen the doctor, consultation is done. But during the consultation, depends upon the doctor's expertise. So when we talk about the doctor's replacement by implementation of the AI, this is the wrong myth across. I would take it as a AI to improve the clinical decision support system, where the tool with the implementation of the AI helps doctor to take a decision. This is a suggestive. This is not a perfect decision on the basis of which doctor will be prescribing it. Had it been the situation, then doctor is not required. If everything has to happen on the basis of the data, why do you require a doctor? Yes, in that situation, doctor is replaced. Because doctor need to have a analytical data with him to take a decision. So once that decision is done, doctor need not to go through the n number of slides. Doctor need not to go to the n number of the reports, the pathology reports of the patient. All things are available readily there to take a right decision. In that way, doctor will be able to consult and attend more patients than the conventional way he is attending today. That is the area we can use the AI to help the doctor to take a faster decision. Consultation is done, doctor has suggested n number of diagnostics or the radiology to the patient. Now patient submits the sample and goes to the laboratory. Laboratory has got its own turnaround time, and then patient has to wait for 1 hour, 2 hour, 3 hour, depending upon different type of tests, the turnaround times are there. With the help of AI, if we can reduce this turnaround time, the patient get earlier report and so he can get the earlier consultation. There we need to implement the AI, we can use the AI to not replace the pathologist, but to improve the efficiency, to improve the turnaround time into the laboratory and provide accurate and efficient results to the patient and to the doctor to take a decision and help it. We are using AI into the radiology, where you have an n number of X-rays, PET happening, so many radiology tests are happening, where AI helps using the data to take the decision by the radiologist. And there are cases, and there have been cases where we identified the radiologist and the top radiologist of the India and the world could not predict the future morbidity into the patient, where basis on the data, AI predicted that after 2 years, patient will be having a cyst developed and can be saved today. So similar type of, like Dr. Rashmi was talking about the evidence base, I would say that all data, all pathologies are depending upon the data. So that data can be analyzed by using the AI and make appropriate and accurate results, which human eyes and human mind may skip. I don't say that our pathologists are skipping, but might skip. Where AI can help us out to take appropriate and accurate results in a deeper science. Similar way, the pharmacy, the drug-to-drug interaction. In hospital, you would agree that we are using the drug-to-drug interaction into the common practice. But how come there are chances where doctor skips it? Patient is already on the medicines or the drug blood thinner, where another doctor gives another medicine which is another further making it worse, or taking the patient into the OT without knowing it, or maybe patient is not sharing that information, but this is sitting in his old data. AI can make an alert that stop, don't do it. He's on aspirin. So those type of AI implementation and uses we need to think and implement it into the healthcare, so that we can take the AI or the hospital healthcare into the next level. She was talking about the palliative care. Palliative care, see, today when we go to the hospital, home, doctor advises in the critical diseases, n number of medicines. You need to take 10 medicines in the morning, the afternoon, before food, after food, before sleep, and all those things. You forget many of the medicines, and more complex becomes this problem when you are in the old age. You need to take care of your old parents, so you need to go to the office and you need to take care of your parents' medicines as well. He is not aware that whether he is taking this medicine or not. If there is any tool which helps patient at home, and just you need to put a tick, you have taken this medicine, put tick, and then your job is done. Here AI can help us out that this patient has taken these medicines, and the outcome is informed to the doctor, and that comes back, that how patient is improving. Your care is done. So there is a lot of scope, sir, where AI can improve the healthcare in every area. I rest my views and thoughts here. Thank you very much.
Thank you, Mr. Goyal, sharing on the aspect as an CIO of the healthcare system. As you also agree that AI can support and help the healthcare system. That's a fantastic, we all are on the same page. Before we move to the end of the session for the vote of thanks, I would like to just ask the delegates here, how many of you believe that AI will replace the doctors? Please raise your hands. AI will replace the doctors. No one? So here itself is the answer, because AI will not replace the doctor. How many of you feel that AI is going to make a big thing in your life? How many of you feel that? 1, 2. No, there are still some who doesn't think that. Yeah. So, there is a big debate going on ethical and non-ethical AI, which is still a big question when it comes to the AI. And ladies and gentlemen, it's a fantastic session which we had. Let's move and invite Dr. Rajiv Chibbal, who is the Joint Coordination Government and Public Affairs of Association of Indian Medical Device Industry. Please.
Thank you. I just hope vote of thanks could also be AI generated. That would have made it more easier to summarize everything on behalf of everyone. Thank you very much. It's a privilege to give a vote of thanks on behalf of such an esteemed panel that we had. and also on behalf of the Association of Indian Medical Devices. I had a few thoughts on obviously how digital health will possibly make new ventures in the country, and we've already seen how Ayushman Bharat Digital Healthcare has really been augmented to a next level. In fact, I was speaking to the CEO NHA just a couple of weeks back, and I said that let's move from the National Health Mission's PPP model to a new PPP model which the National Digital Health Mission can look at, where everyone in that PPP gets predictability, gets precision, and the last thing is patient-centric assistive healthcare. So that's something that I think summarizes what everyone here in the on the panel said. In fact, one thing that AI or one thing that digital healthcare can really bring in terms of a larger change is through creating a robust data, as Goel Saab just mentioned. But even through creating a robust data health ecosystem where every citizen can benefit from a secure health record, a data-driven and a seamless healthcare service that needs to be provided, that's something that we all need to strive towards for. And this will enable precision medicine, disease dynamic profiling, and that's something that every secretary to the Government of India or state secretary will be really looking forward to, because at the tap of his or her tab or computer, laptop, they will be able to also understand where disease dynamics need to be really multiplied in terms of resource precision. So that's something that we can look at, and this also needs to be replicated in healthcare logistics. So even at IMED, when we talk about manufacturers or even the other ecosystems that are created through the medical devices parks, the API parks, the bulk drug parks, or even the pharmaceutical parks, we talk about how your supply chains and logistics can be automated in such a way that it is smart enough to really initiate a healthcare data repository. And the other thing is affordability. So yes, I think when we look at AI-powered clinical intelligence or predictive diagnostics, intelligent hospital communication systems that both ma'am and Goel Saab referred to, that's all what will shape healthcare into a new paradigm shift. And I'll not be naive enough, but we need to also redefine smart. When we talk about smart healthcare, when we talk about smart precision diagnostics, when we talk about smart, delivery systems, I think the smart needs to be redefined for all of us, where S needs to stand for specifics. If we do not look for specifics, that's not going to really help us. That's where we need to go and move more and more. The M needs to be more measurable. When we talk about smart systems, that measurability needs to be intertwined when we look at that patient. The A needs to be more achievable. It's not something that we've just created a hospital of 200 or 500 beds and we call it a smart hospital. It needs to be more achievable. The R needs to be more relevant enough. If we're not relevant with the times, then I don't think healthcare is taking you anywhere. And last, time-bound healthcare is something that we need to look at. Right now, what's happening is we're talking about everything, but it is not time-bound. So if we have a smart approach towards healthcare, that's something that I think could be leveraged in such a big way. But let me end here. I mean, we're all working towards how a healthier India can be formed, how digital healthcare can really take from reality to precision, and obviously the touch of a doctor, and as all of you right now admitted, still remains relevant enough. So let's look forward to augment what the what the Honorable Prime Minister or what the government is now looking at in terms of affordability, availability, accessibility of another A or under that AI advancements could actually be taken forward. So thank you very much on behalf of this esteemed panel. It's a privilege to give a vote of thanks. The vote of thanks does not mean that the session ends here. We have some very good sessions, very well curated themes and well organized speakers and panel chairs who would give more insights into how healthcare systems now need to augment the AI ability, and I'm really sure that everyone will benefit from this. Thank you very much. Thank you. Thank you very much.
Thank you so much, Dr. Rajiv. We have beautiful sessions all over the day till 4:30 to 5 because the next session, which is a beautiful session, because for any digital healthcare you need money. And the next session chairman is going to say that I'll get you the money if you have a good digital product. I also know that STPI is doing a lot of on the funding for the digital. I just wanted to share that we have a couple of principals and a nursing superintendent here. From Holy Family, we have Dr. Kalra and Minnie from Fortis. AI should be there for the education as well. We need to use AI in the education for the nurses, for the students. When they grow, they should know what AI. Most of the time, you go into the clinical and other things, that in your session, you should add AI, one of the session in the medical education as well, which will help the forthcoming medical forces. Thank you so much. So I would like to request Father Dr. Santosh Sebastian to present the mementos to our speakers. Because Father George got stuck. In the new building, there is a fire. People have come to give the permission. So he's stuck there. He'll be joining us. First to Dr. Reshmi. We all come to this thing. Yes. Thank you, Dr. Reshmi, for joining us. It's okay. Leave it. Ladies and gentlemen, put your hands together so that, the person who's giving and the person who's receiving should be appreciated. Thank you. Next to Mr. Arun Goyal, Director, CIO, Sir Gangaram Hospital. Then to Dr. Rajiv. Now let me have the pleasure is presenting the memento to Father. Thank you so much. So we move to the next session. I request the session chair, Dr. Vishal Gandhi, who is the founder and CEO of BIOR's Ventures Advisors Private Limited. Ladies and gentlemen, put our hands together. It is welcoming the next session chairman. After that, we'll have a lunch break. So I'm not keeping any tea break in between because we started at 11. So please, in the center, Dr. Sir, in the center. Shri Atul Kumar Singh, Additional Director, Software Technology Park of India. Mr. Mukesh Sharma, Regional Head, North and East, Alcatel-Lucent Enterprise. Dr. Bhupender Solanki, Assistant Professor, Department of Pharmacology, AIIMS, Rishikesh. My good friend Vivek Gupta, who is a commander as well. I can't see. Hey, come. Who else has to come? So, ladies and gentlemen, this is a fantastic session, as we heard in the inaugural from the doctor to the CIO. This is something where the funding and the IT technology which will help you to run the hospital, and how it should be and how it has to run. You will share from the experts on this. And let's give a big hand to this panel so that they can, over to the session chairman. Dr. to you. Thank you.
So very good afternoon to all of you, and thank you, Shashiji, for this wonderful opportunity again. In fact, I was also associated last year with this event, and I was very hopeful that we will come back again, and I'm very, very proud to be here again, back with our fresh thoughts. So a little bit about, me. I'm somebody, who's lived with healthcare for about 27 plus years.
Just invite Saurabh.
Yeah. Okay, Saurabh, yeah. So as I said, I've lived with this healthcare for about 27 years, and I've seen various aspects of healthcare, starting from research to commercialization to IP to financing. And I think what really attracts me to healthcare, and I continue to live healthcare even each moment, is the gap, right? 1.4 billion people having equitable healthcare, and I think some of it was also reflected back a couple of minutes back. India has the very, very monumental challenge to give healthcare to 1.4 billion people. And I think that just cannot happen through the existing system, because existing system, if you look at, is built to do more sick care than healthcare. I think we weren't really prepared actually to do healthcare. And now we begin to see healthcare because of the emergence of digital technologies. In fact, digital technologies came to deliver healthcare only in last 5 to 7 years, but we see it's getting more relevant. And if we were to provide equitable healthcare to 1.4 billion people in the country, I think it's the phygital. It's just not digital. Digital is supportive, but the future of healthcare is actually phygital. So physical infrastructure, augmenting the capabilities with AI and other digital technologies is the future, and I think we're very, very confident that India should be able to leapfrog, because the kind of startup movement we have seen, in this country, especially on the AI side, is mind-boggling. It's very, very impactful. Rather, I would say it's very overwhelming, because we get to see at least 10 startups in a week who are trying to augment healthcare for this goal of 1.4 billion people in India. And having said that, the solutions are not meant only to provide healthcare in India, but there are some of the solutions which could also be very well, I would say, utilized or leveraged to deliver healthcare to half of the world, which is probably 4 billion people, because the demographic of half of the world is very similar to what India actually has. So I think with that note, I just want to tell you guys, when it comes to startups, we are very, very actively looking at mentoring, investing in startups. There is hardly any team in healthcare that has not been invested or mentored by us, but we continue to go very specific, like now streams like oncology to neurology to any other. I think there is huge scope, and we will continue to mentor and invest into startups which are actually providing impactful solution, because there is no scope for incremental solutions in India, because those are very limited solutions. But if there are disruptive solutions which can actually enable access, what I call as equitable access, I think we'll be very, very happy to support. And just to do a little bit of marketing for our effort. One, of course, I run a company called BioRx Ventures, and the other company that we run is called Indian Healthcare Angels. So through Indian Healthcare Angels, we have invested pretty much into any theme in healthcare that you could think of. And particularly, most of our companies that we have mentored and invested have actually been able to raise the second round of funding from pedigree investors, and that speaks about our involvement in the ecosystem. So recently, we've invested in a company called Articulus Surgicals, which is basically into robotic surgeries. Again, something, which is very difficult for an Indian startup to think to develop a robotic arm, and competing with something like Da Vinci, which costs 30 crores, right? And this product is going to be available at 3 crores, which is 1/10 of this. Now, how do we make and support such companies which are actually offering cost-effective but yet very impactful, clinical-oriented solutions? And I think this is what keeps us exciting. One of our oldest venture-building company called SevaMob, which is actually using AI for last 8 years to do diagnostics at a primary healthcare center. In fact, their AI can pick up that what skin infection you are suffering from, and so that the prognosis can be done in the right way. So I think this is the power of the venture builder portfolio that we have built in healthcare, and we continue to be very exciting to support companies and startups and corporates and investors, who are fellow investors with us, to see how together we can achieve a mission of providing healthcare to 1.4 billion people. And I think this is the opening note that I wanted to make as a session chair, but I can promise you that, we couldn't have had a better panel, than what we have now to talk about the various intricacies of, healthcare. And I think what we're going to be doing is to have each one of them do a presentation on the thematic area, because themes like cybersecurity, themes like government, themes like DPDP Act, themes like, these are very catalytic to the adoption of digital health. And one of the things I think which Arunji also mentioned, that it's easy to develop a solution. And this is what we have seen. Digital healthcare solutions are very easy to build. And it's also from our own experience, we have seen that startups getting, building a solution is very easy, but the adoption is the challenge. And why the adoption is not happening is something that you will learn, that how we can actually build adoption by utilizing the right ecosystem, having the right things in place. If you don't have the cybersecurity, what adoption are we talking about? If you don't have the right people to support you with the right financing at the right time, I think what adoption can we talk about? So I think we are going to be talking about the pillars of adoption. And I think if we were to talk about adoption, everybody will bring their perspective onto the table. So I would request each one of them to probably talk about their experiences, their main product profile, whatever you want to share, for 10 minutes. And maybe towards the end, although the organizers have not kept a time for Q&A, but I think we should give an opportunity for audience to also ask us questions. So initially you were given 15 minutes to talk, but I would request if you can stretch it down to 10 minutes, and then we will have some kind of a Q&A towards the end when every one of us have spoken. I think, is that okay with all of you? Yeah? Okay, so guys, keep your questions handy, and I think we will give at least 20 minutes for Q&A, which was not planned, but we think in order to justify, in order to also learn from each one of you, because each of you are building solutions which we may not be aware of, but they could be very, very interesting for each one of us to know, and how we can play a larger role in the ecosystem to create an impact. And that's what I call as idea to impact. So with that note, I'm going to invite, Mr. Atul Kumar Singh Singh, Mr. A.K. Singh from STPI. I'm very, very proud to be associated with STPI for about a good number of years. So STPI is the principal partner of this event, and I think the kind of work STPI has done, what I know of in healthcare, is mind-boggling, and I don't want to be between him and you. I will let Mr. Singh talk about STPI's commitment to healthcare, and over to you, Mr. Singh. Thank you so much. Please come.
Thank you, Mr. Gandhi, for inviting me. Good afternoon, ladies and gentlemen. It's a privilege and honor for me to address this session at the 3rd Digital Bharat Healthcare Summit 2026. Considering the time limits, I'll be giving a quick presentation who we are, and I'll briefly touch the topic as well. I have a small presentation. I hope this is working. Okay.
You can use that.
So I can. Sure.
And you can refer to that slide.
Sure, sure. So I'll give a brief intro about STPI. STPI started its journey long ago. In fact, we are completing our 35th anniversary this year. We were established as a statutory body, under Ministry of Electronics and IT. So we are serving the industry since past 35 years, and there are different verticals, that under which we are providing services to the industry. This includes software certifications. It comes under statutory services. The main objective of STPI was initially to promote software exports from the country. And you can see the good success story that India is already a big major in software exports. And later on, these services expanded to several verticals. I'll cover a few verticals that STPI is into. So this basically shows, STPI is working as a tech enabler. Some of the verticals include, statutory services. I told you, we have incubation services. Around 10 lakh square feet of incubation we are having across India, and any startup, any entrepreneur who wants to have a space, he can avail the space at a very nominal cost. Even a one seat space is being given to startups, which is very difficult, these days. So 10.69 lakh square feet was the last number. We are also providing data center services, and STPI is having 6 tier 3 compliant data centers across the country. This accounts for 50,000 square feet of space and 850 plus racks. We are also into cloud services. Ananta Cloud Service is one of our cloud services. That is the sovereign cloud of India. So if any one of you have concerns regarding data privacy, so that's taken care of, because it's India's own cloud service. This is providing all cutting edge cloud service with offering full stack of services, whether it's SaaS or PaaS or infrastructure as a service. So these are the few verticals. Very quickly, I'll cover a few more things, like we are providing also high speed data connectivity to the startups. Then there is VAPT services. This is called vulnerability and penetration testing services. Then there are project management services that we are providing to various state governments across the country. And coming to the last vertical, last but not the least, this is the tech. As a tech enabler, STPI is providing services to the startup community. We are promoting the startup ecosystems. We are promoting tech startups across the length and breadth of India. Now, coming to these startup services, there are basically 3 funnels. As you can see, I told you about the incubation space. So we are supporting approximately 400 plus companies or startups which are availing incubation space services with STPI. And then in the center, we have another vertical. This is called Center of Entrepreneurships. These Center of Entrepreneurships are specialized centers. They are domain specific, and they are spread across India, 24 locations. And these are, mini islands where startups get nurtured. They have all the ecosystem, whether it's mentoring, whether it's funding, whether it's physical infrastructure, access to labs. So there is a host of services these COEs are providing. Obviously, these 24 centers are located at one of the bigger STPI centers. STPI is operating across 71 locations across India, and this 24 COEs is just a subset of that, the offerings that we are providing through those centers. And there is another scheme that is called NGIS. It's called Next Generation Incubation Scheme. It is also one of the most successful schemes that was launched with the help of MeitY. Obviously, the funding came from MeitY and Ministry of Electronics and IT, whereby we funded the startups, tech startups. The initial seed fund amount was given, and as they matured, we introduced these startups to various VCs and investors. So these startups are doing also very well, and you can see the statistics that 680 startups through NGIS, 1120 startups through main COE ecosystem, and 400 startups and SMEs we are supporting through incubation mechanism. So very quickly, I can see the time ticker. This 24 location spread is demonstrated through this map. Obviously, it is a subset of the 71 locations. I'll move very quickly. These are the statistics, a graphical representation. As I told you, the offerings that we are giving is, hand-holding the startups, obviously providing their incubation space, funding, mentioning as 25 lakhs through one of the seed funding schemes. We provide internship grants, funding through investor interfaces, industry connects, workshops, hackathons, and we do also have a centralized platform called Sayuj through which we are hand-holding the startups. Very briefly, as I was telling you about NGIS, we have 200 plus mentors enrolled in the NGIS scheme. So that's one scheme. And due to paucity of time, I'm just covering few of the very, very prominent members. These mentors are one of the major pillars of the support that we are giving through our COEs. And these mentors themselves are successful industrialists and domain experts. So in fact, we do have Mr. Vishal Gandhi also as one of our mentors for one of the COEs in MedTech that is located in SGPGI Lucknow. So a snapshot of our mentor base. Partner ecosystem in terms of we have 150 plus partners, and these are basically divided into 4 verticals. There's industry partners, academic partners, funding agencies, and knowledge partners. Obviously, many of the agencies are doing a dual or maybe more than 2 numbers of activities. So they are some of the agencies are listed in both the categories or maybe 1+ categories. As part of the physical infrastructure, we do have several high-end world-class labs that startups can access free of cost once they get onboarded with STPI. These labs include RF and power lab, AR, VR lab, industry 4.0 related labs, automobile labs. Because these center of entrepreneurships that we are having across India, they are domain specific. For example, we have fintech related COE in Chennai, medtech related COE is in Lucknow. So these labs are located and spread across those locations which provide easy access. And some of these labs have been established with by spending quite a lot of money from in the range of 2 crore to 10 crore rupees. So these have world-class equipments that startups can have. I just mentioned the tier 3 data centers that STPI is having. So presently we are showing 5, and the 6th one is in Noida. That's not mentioned here, but we do have 6 tier 3 compliant data centers. Very briefly, I'll touch the MedTech COE as well. It was established in Lucknow with the collaboration of SGPGI. It has supported 50 startups, and we have many startups in this COE which are developing cutting-edge solution, including AI-based solutions for diagnostics and for healthcare analytics and similar setup. Offerings I have already covered, so I'll skip this one. So apart from this intro, I'll briefly touch what potential or what disruptive potential AI is having, in modern times, because AI is evolving. I hope everyone is having at least some idea of AI, what is the basics of AI. AI is basically heavily, dependent on statistical techniques. So once we have a very good set of data on which some statistical techniques are applied, then computer algorithms are put in which can do the predictive things. And similarly, there are integrations across various sectors and fields. This is how AI is, bringing different solutions. And in terms of applicability in healthcare and diagnostics, as all of you are aware that, AI is helping in early detection of diseases. There are n number of techniques like image analysis, radiological reports can be analyzed with AI. But with all these offerings, there are a lot of challenges also. There are good things. Obviously, good things bring bad things. So there are certain challenges which need to be addressed. Of course, in medical science, the discussion between a doctor and his patient, it has to be pretty much confidential. This is one of the basic requirements. But obviously, when AI is relying on the data sets, AI has access to a lot of database, and it becomes a challenge in terms of data privacy. Further, data quality and the end results that we are getting, there is no chance of error in AI-related diagnostic reports. I'll just quote a very old what should I say, discussion that I had with my sister. I started my career as a banker, maybe 20 years down the line. So my sister is a doctor, and I was having a conversation with her. Why, what is important and what is not important. So in this conversation, we discussed that in a banking line, or in any other field, you can do the corrections. Suppose there is a wrong entry, you can always correct it, but not with the case of a doctor. Imagine an ER room where a patient is there. It has to be, dealt and stabilized in real time. So doctor has a very, very, important and what I should say is, important and very responsible job. As I can see the time ticker, I'll briefly try to brief up. I'll just move with the huge platform that we are having. This is a startup community network that we are offering all the offerings of STPI through this. You can scan this and you can download this. The Sayuj platform is offering a lot of collaborative nature of things, whether it is mentors, whether it is investors. You can host your challenge programs here. You can access the various resources that we are offering across India, and the policies, the schemes, the knowledge sessions, and the ecosystem access. So in case you want to host something, in case you want to connect with some mentor or some investor, so it is a very, very excellent platform. And with these words, I would like to conclude. And thank you very much for having us.
Thank you, Mr. Singh. I must say that, from my own experience as STPI may be 33 years old organization, but actually it behaves like a startup, guys. So I just want to leave a note that, for anything for startups, I think STPI is a central point, and do download the app. You will be able to leverage all the ecosystem which exists today. So I think what we can do is maybe we can take the questions at the end, if it's okay. Anybody has any pressing question for Mr. Singh? Or we do it later? Okay, fine. So now let's do a segue to a very interesting topic, because today we are talking about AI in healthcare. But if the base of the hardware and the software is not right, what are we going to do with AI? So I think with that, I'm going to introduce you to a wonderful panelist, which is Mr. Mukesh Sharma, Regional Head at Alcatel-Lucent. I have known about this brand, definitely, even from my Ranbaxy days. I think we were all on this platform, and I'm sure it has really gained a lot of traction. So guys, what AI can do without hardware and software is nothing. So it's very important for us to understand the foundation of any hospital, what we call a smart hospital. And then, of course, we'll also learn a little bit more what we do not know about the infrastructure, healthcare infrastructure that actually exists and offered by Alcatel, right? So over to you, Mr. Sharma. Thank you.
Thank you, Vishal. Thank you, Vishal, for giving me the time. So, I'm Mukesh. I'm from Alcatel-Lucent Enterprise, and we are providing network and communication platforms to the hospital. How our network and communication platform provide the smart hospitals. Smart hospitals because I'm a user, so I know the importance of each and every component which we are providing. So I'm here sharing my company experience first. So this video.
Ever since the beginning, human beings have been striving to perfect the exchange of information and feelings. That's because the essence of life is to communicate and connect. With the advancement of technology, especially electricity, pioneers and inventors have blazed new trails to achieve this mission. For Alcatel-Lucent Enterprise, the first technology breakthrough came in 1919, when Aaron Vale created le téléphone privé. This anticipated the vision that all companies would need a reliable means of communication to drive prosperity and sustainable growth. Just a few years later, Vale's newly formed company, Telik, began selling advanced usage-based communication services. On the strength of its business model and communications technology, Telik thrived in the roaring 20s, a time of great mobility, engineering marvels, and social change. The transformation accelerated during the second half of the 20th century with CIT, la Compagnie Industrielle des Télécommunications, and finally with the creation of Alcatel and Alcatel-Lucent, a global telecommunications powerhouse. Business vision and new technologies produced more breakthroughs. Thanks to our communications technologies, businesses and societies around the globe have been able to take a great leap forward. We have built high-speed digital networks and helped thousands of enterprises flourish and succeed. It's also been instrumental in helping businesses enhance the customer relationship, making contact center technology widely available. Around the onset of the new millennium, Alcatel-Lucent Enterprise was born. That's when the company implemented a new strategy to seize the opportunities of digital transformation, the cloud, verticals, and the Internet of Things. And this was just the beginning. Since then, Alcatel-Lucent Enterprise has continued to invent and shape the future of communications. Whether it's biotechnologies, nanotechnologies, the science of emotion, autonomous vehicles, space travel, or transhumanism, Alcatel-Lucent Enterprise will be there. Today and tomorrow, we're connecting the future.
Thanks for your patience. So, Alcatel is a 106-year-old company. Major milestone was 2006 when Alcatel and Lucent come together and form the organization. So, I'm Mukesh. I'm working with Alcatel-Lucent last 15 years. I'm not here sharing my technical things, technical jargons, what we are doing. I'm sharing the experience, how we are providing, how we are supporting hospital to provide the world class of the services in the communication and the network. So, we are based out in France. It's a French company. For the data, headquarter is US, Calabasas. We are serving 50 plus countries. We are having 1 million plus satisfied customer, which is my key to success, which they are using my services day in, day out. In India, our headquarters is based out in Bangalore. We are making India Class 2 certified service providers. We are having across our R&D centers is there in Chennai and Bangalore, and we are having around 500 plus employees in this company, 15K plus customers and resellers. So this is my punchline, Alcatel, where we connect everything, where everything connects. We connect people, process, and robots. So how this is in my next presentation. Just a minute, I'm not able to see my presentation. Technology, how technology making the impact. There are 4 key pillars which are nowadays driving the technology: AI, cloud computing, security, and all the basis on that, business innovations, AI, everybody is talking about the AI. Cloud is important because cloud will help to decentralize the things. Need not to put all your hardware, software at one place. You can use the centralized resources. Security is must because data is a, thank you. Data, because we need data, because data is a security is required, and all these together give the experience, business experience. So we are providing digital age communication and the networking solution, hardware, software, and we integrate various kind of support softwares to provide you the services in the communication and the networking. So now these are the 3 key pillars for the networking, which is autonomous network, IoTs, and business innovations. With the help of these 3 platforms, we are giving the services. In a hospital, how? Networking is a key, very important, because my network, whatever we deployed, knows the importance of the data, what doctors are required, what patient is required, and other application. We are integrating other applications with our network, and basis on the requirement. Like I'm giving the example, the doctor need high data files at the time of operations. So my system is aware that different VLAN is required for the doctor, different VLAN is required for the customers to provide the world class of the services. So me and my company knows we design the solution basis on the requirement. Now I'm moving towards our communication platform. These are the 3 pillars for the communication. Communication is all about the experience, employee experience, customer experience, and to provide this experience, this wow factor, you need good communication platform. We are providing the communication solutions, IP telephony, call center applications, integration of various hospital softwares like HMS, nurse call system with the same panel. So that will ease when patient is suffering with the pain, that this process will help to the customer from the admission to the discharge. This will help, our platform will help in the telemedicine also. While you are in a hospital, we are providing the services on the bedside. Our call center will connect people with the right doctors, follow-ups, and ease their pain. I'm moving towards now. We are serving 5 verticals, and healthcare is one of the key verticals. We across the in NCR, across the globe, we are giving services to world class of the hospital. So now I'm moving toward, this is my reference list. So if I'm starting from Delhi NCR, so more than 15 max hospitals using Alcatel. Not only in the Delhi NCR, we are there, max in Mumbai and even max Punjab. My next, I'm referring the Asian Cancer Balaji Hospital. They are using our communication platform to serve their customers. They are using our call center. When you call the hospital, your call lands on the Alcatel platforms, and we distribute your calls to we are connecting you to the direct doctor. Our platform, this is not only for the one, because if you are, our solution, if you are using Alcatel solution, you can connect multiple of your branch networks on the same platform. So in Alcatel, not only the hospitals, we are there in their manufacturing, like manufacturers, Mankind Pharma. Across the country, they are using Alcatel voice and networking solutions. ILBS campus, entire campus is on Alcatel. Last more than 10 years, I am the guy who supplies.
Mukesh, 1 more minute left.
Yes, sir.
Yeah, 1 more minute left.
Yeah, I know. It's 4 minutes.
So no, we will keep the Q&A.
No, we are here for the Q&A.
Okay.
My team is there because I'm not. Sure. I'm sharing only the references what we are doing here. So because that is my key. Key things which I would like to share with the audience. So so across the country, you name the hospital, we are having the references. This voice and the networking solutions, we are integrating with the various kind of softwares to improve the infrastructure in the hospitals. So now these are the 8 points why only Alcatel. We are providing end-to-end solutions. We are providing solutions from voice, switching, and the WLAN. This platform is trusted digital transformation partner. You can trust on us. This network, our network is very secure. We are providing the long-term services, support, commitment is there. We are serving hospitals more than 20-25 years. Max Saket is one of the example. From day one, Max Saket is using Alcatel platform. Various now they are expanding, and we are giving them the services. This healthcare is our strong vertical in healthcare. We can integrate with your chatbots also. We are providing the location-based services. So, and one and most important thing, we are following the open standards. We are not following the proprietary standards. So these are the few points which I would like to share. I'm here with my team. You can ask me. We are providing communication and the network solution for all the hospitals. So you can ask me if you have any question. Thank you.
Yeah. Do you have any questions for Mukesh at the moment? Maybe we could take it up once the panel is over. Yeah, thank you. Thank you, Mukesh, for taking us through the infrastructure part of the healthcare. I think every hospital has to become a smart hospital, and without that base, it will be difficult to achieve that. Now, coming to adoption, as I was mentioning, I think we'll not be able to go full on if there is no security, right? Now, so it's time for me to invite, somebody who really is expert and represents a company called TechBridge. He's a CEO. That is Mr. Agrawal. Mr. Agrawal, why don't you talk about cybersecurity aspects? Because that's very important, especially coming to DPTP Act now in place. Thank you.
Yeah, good afternoon, I think. Good afternoon, everyone. Thank you, Mr. Gandhi, and esteemed panel here, and everyone as an invitee. It's great to talk about something very critical, which is hospitals and the medical infrastructure. Today, just give me a second. Okay, I'll just take few minutes on giving the introduction to the organization. So we are TechBridge, and it's been around 11 years for the organization in the country, and we have served clients across the globe, from Middle East to ASEAN, and have our presence in India, South Asia, Middle East, etc. And we work closely with many of our esteemed partners and customer ecosystem. So actually, one thing which I want to share very important is that TechBridge is a deep tech organization, and our products are for organizations which are running or managing the critical infrastructure. So, and the hospital ecosystem is a critical infrastructure. There is lots of information and lots of critical components which are sitting across, and probably they have one of the, हम कहते हैं कि डॉक्टर के पास जाना, सीए के पास जाना, वकील के पास जाना, आप सारी चीज़ें कुछ छुपा नहीं सकते, छुपाना भी नहीं चाहिए. So they have every information, every bit of information of every individual, whatever may be the big in size and small. And so it is a critical set of information which is there with them. And we are playing role in that. Okay. So a brief about, yes, we are certified following the forums and various recognitions for the organization. 100% homegrown organization in India. All engineering team is in India, and everyone is contributing towards the growth of the country. And as I said, we are a deep tech organization, and the whole medical and hospital infra is becoming a deep tech organizations as well, because technical and digital has role in every aspects of the working today of the hospital ecosystem. Just to give further, whatever we are doing, we have recognition from Gartner, one of the esteemed and globally recognized analyst organization, and our product line is being recognized across by Gartner, both in terms of infra monitoring and also the infra cybersecurity. So TechBridge has a role, and we have got an opportunity to serve the very, very large critical infra organization in the country, which is like Intelligence Bureau, Ministry of Home Affairs, or the GSTN, or even the hospital ecosystem in India. One of the very critical hospital management information systems we have worked across. Okay. So I'll just briefly tell about couple of, TechBridge has, so we work in the IT infra side, and we have a complete practice of infra monitoring, and I'll tell you a couple of things around that in a short while. So we have complete infra monitoring setup, and the same thing has been deployed with Mumbai BMC, where 400 medical facilities have been integrated into a single HMIS platform. And this whole platform which you see here is being deployed there, and is working day in and out with the BMC infrastructure, where 400 medical facilities are in place and they are integrated into HMIS platform. I'll just skip this. This is more of English in terms of what are the benefits. We'll talk later. This is a bird's eye view of the platform, how it looks like, and how it is provided to the users. The thing which we wanted to discuss more about is the cybersecurity part. As we said, actually today, as we talk about the hospital infrastructure and hospital system, DPDP Act, INTT, is one of the very critical part, and then the file integrity monitoring, where all the information which is saved across and it is accessible to many people, that has to be monitored correctly. So we'll discuss again further in detail about this as well. Couple of things about what benefits that our TechBridge CyberCO platform brings on table. So it's a one important thing about the whole platform is it's a SOC in a box. So I can tell you, like, for the hospital system, we can deploy and bring up the system up and running in a month maximum. So the whole ID part we do in a week, which is what the efficiencies we have brought upon. In the light of the situations like DPDP Act or data security or data and the information security around that, we have done very detailed work, and a lot is being worked upon in that direction further. This is a bird's eye view of the platform, which it looks like. Okay. So, a couple of things on the tech bridge for the healthcare ecosystem. What we are playing role is that secure and intelligent infrastructure for modern healthcare systems. So, TechBridge has a role in that direction, and we have been helping the organizations, healthcare ecosystem in that direction. Because digitization has increased and it's all IT infra, hence TechBridge plays a critical role, which we have done with other customers, where we can always help you further. We have in the light of compliance also, and in the light of requirements as into day in and out operations. So we are there together with you to help you in running the ecosystem. Okay, so as I said, EHR everywhere, telemedicine, remote connectivity, remote patient monitoring, connected medical device, AI-driven diagnostics, and cloud-based hospital systems. In fact, I'll share one experience. Recently, I went to a doctor myself, and he was noting down everything on a cloud application. He insert whatever diagnostic, whatever I was telling him, he was verbally speaking, and all of them was being noted down as a verbal notes, and that verbal notes were being converted into a text. And let's say, and now I am assuming this is happening to with many of the people. So all the verbal notes are there, the text, speech to text is being implemented there, which I am assuming some Google or some APIs are being used for the translation or conversion. And all this data is being saved on cloud. And then all the diagnostic, all the prescription is happening on softwares. And even the clinical systems and the patient management systems or the queue management systems or information management systems. So everything is on a digital infrastructure. Now all this digital infrastructure, which I am sure many or some of us would have gone through, would have realized that now this is the critical component of any hospital system. Now putting in place is fine, but we all know that many records are available on dark web. Now the records are not only limited to name and number or contact details, but it is about the information about every individual. There are individuals who are worthy personalities across the country, HNIs or anything, and that is being used across. Even we are seeing lots of digital arrest scenarios. We are seeing lots of cyber frauds. Now all that is happening because of information leakages. Now information leakages are happening, and it is like even the HMI systems are a potential they are facing potential threat vectors. Now what TechBridge is doing is helping to overcome these threat vectors. We have done that, and we are continuously doing research and development in that direction. We have filed patents also in that, where we are making sure that in such informations, or even, I'll tell you one more very important thing, and it is globally proven kind of, that many of the threats come from insiders. That is called as insider threats. It can come through data leakages, or which is having a requirement of data leak preventions, or file integrity monitorings, security of the data and the information, which is what is covered under somewhere DPDP Act as well. So as an organization, TechBridge is engaging, supporting, helping the hospital digital infrastructure to overcome these scenarios. Obviously, we keep on learning, we keep on evolving as a homegrown organization, and we have done that in the past. And even in terms of like, the doctors or the hospital staffs are, I'm just assuming that it's an evolving phase. So the IT infra is pretty large. So there are other tools in terms of how do you, cover those risks. No, it's not only about identifying the risk, it is also about how do you recover the systems. So we work together with the hospital systems to, one is to identify and then, seclude them, and then also recover mechanism. Where how do you recover all the infra and your information is kept secret, saved, sorry. So as a company, we are continuously working in that direction, that how do we help the customers or the hospital infrastructure, the IT digital infrastructure, be always be secure, and they keep on evolving as the new requirements and challenges coming up in the market. So as I said, operational challenges and the security challenges, which we see even the case which happened in the AIMS, where lots of critical infra was compromised, information was leaked, and then ransomware was there. So we know something like a decent amount was paid to the ransomware the people, and it was released. So one more important thing which I want to highlight here is that as a company, since we run on the IT infra, we do the monitoring and cyber security. Our experts have the capability, how do we do unified monitoring? So unified monitoring means 360-degree view of the IT infra, which is about what is entering, what is being maneuvered upon, what is being compromised, and how do we recover and finally bring it to the shape. So it is very critical that we do the 360-degree view of the whole IT infra in the digital environment. And it is not only spanning across only cyber security where it works in silos, but we are working across with that in tandem. There is infra monitoring and security, and hence 360-degree view of the system, which is very critical for any organization. That is a value, and it's not about value as well. We understand the pain of the hospital IT systems, which is where we want to pitch in and help the organizations to overcome these challenges. So as I said, we have two platforms, ObservaX and CyberCO, which is one is complete IT operations setup, and other is a SOC in a box. In terms of capabilities, the infra monitoring, application performance, network observability, and the monitored systems are all as listed below, all the kind of the various IT and digital infrastructure that any hospital has. In terms of healthcare security, the IT infra in the health ecosystem security, we do the complete identity and threat detection, ITDR. We have appeared in the Gartner report for ITDR itself. And security analytics, incident investigation, automatic threat response, unified SOC operations, protection against ransomware attacks, monitoring the clinical identity misuse, detecting insider threats, and SOC investigation and peace of mind. So eventually, it's all about 360-degree view on the cybersecurity front of the hospital infrastructure. In continuation of what we are doing in terms of information is also about your medical equipment, or your MRI machines, or any information coming out from there. It is also, or it's part of sort of OT security and the IT security. We do have capabilities, and we help the organizations to cover that as a wholesome from 360-degree view from the security purposes. Okay, so again in continuation, identity security for clinical environment. identity, I think it's a very big piece because information is again today identity, I think, is one of the biggest threat vectors for any organization, and especially the medical ecosystem. Coming to the next one, the service continuity. As I said, all said and done, it is very important that the hospital or the medical infrastructure, at the end of the day, patient doesn't know, he doesn't understand, and he doesn't want to know, he doesn't care about it, how do we manage the system. It is we all together have to make sure that yes, the system is in place, system is running, and any operational challenges are handled accordingly. The idea is about the IT system or the medical management. They have to make sure that the as an owner of the business and owner of the medical system, he wants that their customers should not be, impacted. Eventually, if someone comes to know that some data got leaked or some information got leaked of someone, they will not spare the hospital, let's say. And and as much as the systems are becoming autonomous, are they scaled accordingly? That means that the right checks and balances have to be in place. Right, IT ecosystem is fine, but at the same time, it is running with security is very, very important. You don't want something to be leaked upon, and then some challenges are faced from the market. So we are here together. We are here to support. We are here to help, and we look forward to working together for the like-minded people. There is something on compliances which we are doing, and as I said, why healthcare organization choose TechBridge? We are done. Thank you, everyone.
Thank you, Mr. Agarwal, for sharing the nuances of cybersecurity in the healthcare and life sciences. I was thinking that you're probably more focused on healthcare, but I could also see that you've done something in life sciences, which is my passion area. And so it's really fascinating to know that something like this exists. It's vertical integration, right? So very, very nice. I could learn a lot. Thank you. Coming to a very important topic, guys, I think this is something which I think very, very close to each one of us, right? When at least as a patient or we go to any hospital, we see medication errors. How many of you have actually learned about medication errors? Can you raise your hands? Anybody that you know had actually suffered because of medication error, right? Okay, so I think quite of us, right? So how does medication errors be reduced? Because the staffing is overwhelmed, right? So this phenomena will only continue. And how can we leverage technology to reduce the medication error in the clinical setting is a very, very important area. And we can't get a better speaker than somebody whose research has been in this area and who comes from AIIMS Rishikesh, Dr. Solanki. Dr. Solanki, over to you. Thank you.
So, very good afternoon to all the dignitaries and all the respected members here. Thank you, Dr. Vishal Gandhi, sir. And thanks to the organizers for giving me this privilege to be here and talk on this topic. So, to begin with, I'm Dr. Bhupinder Solanki. I'm from Department of Pharmacology, and I come from the All India Institute of Medical Sciences, Rishikesh. So AIIMS Rishikesh, it is one of the second phase AIIMS which have been established by the government of India, and we are, one of the institutes which are still in their infancy, infancy stage, and it was established somewhere around in 2013. So around 13 years have passed, but one thing which I will like to highlight is the immense progress which our institute has made. So starting from around 350 or 400 bedded hospital to now being 1,000 plus bed, and which newer critical care units which are still underway, and maybe in next 6 or 7 months we will have a satellite center of our own for the super specialities. So having said that, we have made a lot of progress. Now the pharmacology, the department from which I come, so before moving on to the AI component or my talk, I will just clarify that somehow there is a confusion that pharmacology, is it something related to pharmacy? So this is just partially correct. Pharmacy, or the general perception is that, okay, so this is the chemist or the pharmacist, those who dispense the medicines. So as a pharmacist and pharmacologist, they are two different domains. And yes, pharmacy is one of the part of our job as a pharmacologist. I'm from the clinician side. From now on, you have seen a lot of talks from the industry perspective being done on with relation to the AI. Now, I will from this podium, I will like to highlight, like, you can take it as a proposal or an idea how this AI can be integrated with the this healthcare setup or the healthcare domain in which I work, that is the pharmacology, and one of the domain is the pharmacovigilance, or we run a ADR monitoring center at our place. So I'm going to talk about, before going into the topic, I will just brief you about what is the ADR. So adverse drug reaction, it is simply in simple terms, we say it is a side effect. So any harmful or unintended reaction occurring due to a drug, we simply label it as the adverse drug reaction. And now, the problem is that even though it is the 4th to 6th leading cause of death worldwide, in some countries it might be 4th, but it maintains a top, place in top 10 among the most important causes of the death. So despite that, there is a 90% gap, that reporting gap which is there. Most of the ADRs, when they happens, then the physicians, they come to know they have to treat it. Sometimes it become irreversible. So still there is this 90% of the time it is not reported at first. So what is being done in our department, like we have a pharmacovigilance system, we have the doctors, we have the pharmacovigilance associate, those who go into the wards, OPDs and the emergency setups, and they screen for and go through the individual patient, their records, and screen for whether any risk of adverse drug reaction is there or not. And we try to prevent those. And also, if some adverse drug reaction has occurred, then they are being referred to us for the further optimization of the therapy, what further drug management can be done. So the problem is that this spontaneous ADR, you only see, we have 1,000, now we have 1,000 bedded hospital, and going to individual beds and screening through all the records, it is very laborious and very difficult. And also from the side of the clinicians, if we see, so they are also overloaded with the, the situation of the government hospitals, and there is always, so much patient load that we cannot expect from the physicians to report to us. So what is the solution then? The solution could be the integration of this AI into our pharmacovigilance. So what is done is, like, once the pharmacovigilance associate, it goes onto the OPDs or the wards, they then analyze and screen through the patient history, the relevant examination, the various tests which have been done, then they try to identify the reaction. Then it is uploaded into the VigiFlow system and reported to us for any further improvement or management. And then we have a national coordinating center, which is Indian Pharmacopoeia Commission, Ghaziabad. Then they do the further processing and analyze the reaction. So how this, what is the core problem with this is that mostly in the hospital setup, we have the doctors, they write in a free text manner. Tablet paracetamol, this much mg for this much days, and the writing, you also, how is it. And we have been, we are popular for this, that our handwriting can be only be understood by either us or God or the pharmacist. Okay, so that is the major problem. So if we can train this, if we can train the AI model for this free text, and particularly for our institute, we are now running our own electronic hospital ID, so e-hospital setup we have. So the databases, the patient, prescriptions, their discharge summaries and treatment charts, all that are being uploaded on the e-hospital IDs. So that can be, a model can be trained with that data, and it can be made more, from unstructured to the structured data can be made, which can be further analyzed. So how this can be, taken forward? So it has got three different components, which I say. One is the NER, the name entity recognition, in which there will be like the individual drugs or the individual symptoms that can be recognized by the AI model. For example, say paracetamol, the rash has occurred, vomiting, diarrhea. So all those individual entities will be dealt with, will be trained to the model, and then there will be the second component will come in, which is the relation extraction. So what is the relation extraction? Like once this has been established that these are the drugs, these are the symptoms. Now the thing which is done, that whether this reaction, this rash is due to the drug which is prescribed, or it is because of, it is a part of the disease, or it is already some other comorbidity which is being present in the patient. So that relation extraction will be, it can be done. And then the third component will be the context detection, or something, the negation handling, which I will say. Okay, so this was what just I was telling the example. So in the context, so I'm not going into the more of the technical jargons, because it will be more of might go over the head. So I will just I'm just giving you a tangential thought about that. So like negation also, once you have ruled out, once you have established the relation, now you can all the one component is the all those history, like no family history of diabetes, no history of rash, no history of or no previous history reported for this so and so condition. So all those things can be further dealt with by the AI model, and then can be for the causality assessment that we do, it can then be done. Now, once this model has been developed, so we can simply integrate it into the electronic hospital records, which or like the e-hospital system which we have. So it will go through all those databases. It will then on the basis of the whatever the data it has analyzed, it will then generate the flags. It will identify the flags. Okay, now one thing which we have been saying, which we have heard in the morning itself, morning sessions also, that now since the pharmacovigilance associate was doing all these things, so now they are jobless. What will they do? This has already been done by the AI. So now comes the importance of having the human in the loop. Sometimes it is possible that those areas which have been flagged by the AI, they might be simply over exaggeration of the symptoms. So that has to be validated by the human, by the pharmacovigilance member of our team, and once it is validated, then only it will be further processed or reported. So that is how this can come into the picture. So simply just giving an example, for example, the model, once it has been developed, using the NER or the named entity recognition, it will identify it identifies, okay, vancomycin, it is an antibiotic which is given for certain infections, it is prescribed, and it can cause one of the important adverse drug reaction which is caused by it is the renal toxicity or renal failure. So this has identified, okay, there is vancomycin given, there is renal toxicity happening, or even if before the toxicity has developed, there is a marker for that, which is by monitoring the renal functions. So renal functions, you know that we have the basic two parameters that we can use is to measure the urine output and the blood serum creatinine levels. So these things, these can be whether there is an increasing trend or whether there has been a plateau. So all that background, that relation extraction which I was talking about, that can be done by the model itself, and then it will raise a flag. Okay, so this patient was on vancomycin. There is a rise in serum creatinine. So probably it might have a risk of kidney injury or nephrotoxicity. So therein the physician or therein we can interrupt or we can intervene, and we can discuss with the treating physician that, okay, so and so patient, now you have to either reduce the dose or you can replace, say, vancomycin from another drug which is more of renal friendly. So all those inputs then we can give to the physician. So this was a basic idea of how we can integrate the the NLP or natural language processing in the ADR system, and this is just a beginning, and there are a lot of limitations for it also. For example, the main thing is integration with the e-hospital setup. So you need a lot of logistic administrative support for that, and obviously that for that you need a cloud network to work upon that. So that will require a lot of funding and IT support as well. So that is what all I will propose, that maybe we, since all the IT industries are there who are working towards the healthcare, so maybe this could be taken up further and it could be further developed for have a better prevention of the ADR and medication safety. So thank you all of you.
Thank you, Dr. Solanki, for sharing the various aspects. And I think one of the hypotheses that you spoke about, how can we leverage AI to reduce the medication error, is a very transformative step. And I think this will become a mainstream. And I think Government of India must look at it from a pharmacovigilance perspective, because DCGI actually has this amazing responsibility to have this aspect. And I think how MeT's electronic ministry can work together with DCGI to build a robust system and leverage your expertise, I think it's a very unique initiative. It can happen, and happy to support in whatever shape and form. Thank you, Dr. Solanki, for bringing those important aspects. Guys, I think it's an important time to introduce not the last speaker, not the least, but somebody, I can relate to, because I worked with Ranbaxy. In fact, my first job was at Dabur Research Foundation and then Ranbaxy. I think Ranbaxy was #1 pharma company when I was an employee. And what led Ranbaxy to actually exchange hands to Daiichi, and then later it became a part of the bigger umbrella called Sun Pharma, compliance management. If you do not do the compliance, right, and a compliance is not just the governance from a perspective of finance, compliance from the perspective of sustainability. And within that, I think all the certifications, whether you call it US FDA, you call it GMP, I think if those compliances are not reported, and I think I'm aware of a concept called 21 CFR Part 11. At Ranbaxy, we were evaluating having a LIMS, which was something was provided by Oracle. And what I was told that we have to select somebody who has this compliance of 21 CFR Part 11. Now, 23 years ago, we were thinking of this, but I'm sure things have really transformed a lot in last 23 years. So let us learn from nobody other than somebody who's managing, as a CIO of the largest company in the pharma industry, which is Mankind Pharma. And we are very proud what Mankind has done to the humanity, because I think when I talk about my mission, it's about affordability. And I think Mankind has disruptive that model affordability, accessibility. And so, sir, please go back and convey my sincere gratitude to Mr. Juneja, who I also happen to know well, but phenomenal work. And I think you continue to strengthen your systems, which is the beauty. And we're looking forward to hearing your thoughts.
Good afternoon, everyone. I think I'm standing between lunch and you all. I will try my best to keep this session as attentive and informative as possible. My name is Lieutenant Commander Vivek Gupta. I'm an ex-naval officer. I spent more than 10 years in the Navy. I did my master's in computer science from IIT Kanpur. And in 2003, I took premature retirement to join the corporate world. So I've been in the industry for now close to 23 years. This journey encompassed working with organizations like Deloitte, IBM, Fidelity, Nortel, Avaya, and I went to Middle East working with one of the largest retail giants there, Landmark Group, and world's largest private education company, GEMS Education. Subsequently came back to work with Adani Ports, the biggest Adani group, and now with Mankind Pharma. In this journey, I have always been in technology space, different aspects of technology, predominantly in cybersecurity. And I've been on both sides of the table, customer facing and on the customer side. The theme I have been given to speak on is a cyber resilience, knowing today's threat. I'm sure everyone sitting here has got a smartphone. Anybody who does not have a smartphone? Anybody who is not connected to internet? 20 years back, when Bharat Exhibition had launched an event in the month of March 2006, which is 20 years back. I was the keynote speaker that time, and it's 20 years I'm still speaking here. What I've seen is those days, access to smartphone was not there, and internet was a luxury. Today, we see it is part and parcel of our life. This slide speaks about my pedigree. As you can see, all from the Navy, which is the military organization, to corporate, I've worked in all these companies with different certifications and education. Given that today the risk posture is totally different than what 20 years back I was speaking. If I have to share some talking points, I don't know if anybody has seen the World Economic Forum report, which happened in Davos a couple of months back. It said that amongst the top 25 global risks, cybersecurity is among the top 10. Is there any business vertical which cybersecurity today has not touched the need? Number two, since the audience here is more healthcare focused, you will be surprised to know that in top 25, there are 2 global risks which are pertaining to healthcare. 2 out of 25, 2 are pertaining to healthcare wellness. They are so risk, and in the long term, they are saying that these 2 risks will climb from top 25 to top 20. That means the importance of all the audience who is here is only going to grow with time. That's what World Economic Forum report is saying. Given this background that cybersecurity is so important and healthcare is so important, a combo of 2 becomes deadly. No brainer. And given what happened 24 hours back or 48 hours back, a company called Claude, I don't know how many I've heard because I've heard a lot of people talk about AI. One of the leading AI companies, Claude, who was the reason behind market crash in technology some weeks back. 24 hours or 48 hours back, they have launched a model called Mythos. It's in the Google. That model can tell all the vulnerabilities, the weaknesses in your digital environment. Now, if this model lands into the hands of threat actors, even operating systems which were thought to be robust, ruggedized for 15 years, no vulnerabilities. They have found thousands of weaknesses there in those systems. So much so that the governments have called all the banking sector to start with. How do we protect against this model, which the model is telling that this is the weaknesses, and if we crash into those weaknesses, what should we do? Now that is one part of the thing. The second part is, now how do we solve this problem? Security is a journey. In this 20 years which I have been associated with Bharat Exhibition, what I was speaking 20 years back, in their website also you will see that 2006 when I presented and when I'm speaking today. What has changed is the types of attack and the weaknesses. The pillars some of my colleagues have already spoken about: people, process, technology. They have spoken about the solutions they are providing. They were there that time, they are there today. Only the scope and the integrities have changed. We will have to build resilient infrastructure to ensure the healthcare digital footprint is up and running, as the need of digital healthcare is only going to grow more important. With AI adoption, which every speaker has spoken about, is only possible with the growth of digital. If digital is growing, that means cyber security has to be bundled. It cannot be bolt-on, it has to be built in. My request to all, that like we take our personal information at home very seriously, and we see our data privacy, our children's personal data, their health reports, we safeguard it, the same controls and more is required in the organizations. There's no difference. And to top it all, with new AI models bringing out all the weaknesses at the fly of one prompt, one command. If you do a search that how is my one medical report, if you give it to the AI model and say what are the things it can do, and it can tell you everything, but then the data is gone. So, and on top of it, that the model can also, as we saw, give things which we call data poisoning. So if the data model is not tuned properly, it can give you the negative effects. And you will think that you've got some medical problem, and most of us try to be Google doctors, losing the fact that actually real doctors are the ones who can guide and advocate better. I'm not trying to scare. I'm not trying to make a situation alarming. I'm just sharing what is happening in the real world. Pharma sector and healthcare sector in last 5-7 years have undergone lot of cyber attack. One of the biggest hospitals in NCR underwent cyber attack. We all know about it. Till 5-10 years back, nobody thought healthcare and pharma sector will be under the impact of cyber security or cyber risk. But today, if you do Google, you name the hospitals, you name the pharma companies, they have all been breached. Some have reported, some have put it under the carpet. That's the difference. Cyber resilience is the need of the hour. Building good technology infrastructure on your digital roadmap with AI embedded and over-encompassed with cyber security will ensure that the organization will go through this rough weather which we are facing, and it's only expanding with day and time. Ladies and gentlemen, once again, I would like to thank Shashidharan for inviting me for this session. And this is an area we all need to prod. We all see every day cyber attacks happening in newspaper in the form of, today's buzzword is digital arrest. But these themes will change. They are more individual-centric. Organization-centrics are different, like ransomware attack and all. One of my speakers spoke. I've gone through ransomware attack, and we survived 24 hours downtime with one of the largest threat company in Europe who had attacked. This is something which is happening and is a need to be protected against. Thank you.
Thank you, Vivek, for sharing the, I would say, wonderful insights. I think all of you brought very synergistic aspects. And so before I sort of give my closing remarks, if there are any pressing questions from any one of you, I think we can entertain 1 or 2 questions with the permission of Shashidharan ji. Can we have 1 or 2 questions? Yeah. So, or comments, if you want to share your comments, that also is fine. Anybody wants to volunteer? Or it was so crystal clear, looks like it was crystal clear. I would assume that, right? Okay, so guys, thank you. At least from the panel, I learned a lot. And we had Mr. Singh talking about nuances of STPI's contribution in the startup ecosystem. And I fully echo the kind of contribution STPI has made is humongous, and we should all leverage on it. Followed by Mukesh talking about the hardware. The smart hospital can only become smart if the compatible hardware is there, and I think he touched upon that. Then, of course, how do we bridge the cybersecurity? I think Vivek and Saurabh touched upon that, which is a very, very important part. And I feel if digital adoption in hospitals have to happen, I think they will need to bundle up with cybersecurity. It's just not going to be isolation. And cybersecurity is a very, very important aspect. Like today, I could really learn a lot from each one of you, and I'm looking forward to learning more further. And last not the least is we have Dr. Bhupinder talking about drug-to-drug interactions. I think this is a very common topic, but the potential of AI in understanding how can we reduce the medical errors is a very transformative idea, and I think government must think about it. I will write an article about it, definitely, and in my own capacity, we will see how this project actually takes a shape, because the numbers of medication errors are only going up. And I think we need to do something there. So back to Shashidharan ji. Thank you so much for the opportunity.
Thank you so much, Dr. Vishal. Cybersecurity itself is a whole day subject. And Vivek, my good friend, has been talking since 2006. Every year, we started with network security, we'll end up with digital arrest. You know, in 2006, we were talking about mobile network security, the telephone security, now we are talking about digital arrest. As we all losing money every day, OTP de do, we give our OTP and then we realize that the money is gone. So somewhere we also need to learn what is cyber security, what is digital arrest, what is OTP. Now soon the government is working on a double confirmation. It can be your voice OTP, which is under consideration, which is the OTP comes, you type the OTP, as well as the voice you have to say 0121 or whatever is the OTP. So it has been told that we have 136 algorithm in the voice and nobody can copy it. So that is what the final going to be. The voice is going to be even that the passport and the immigration, it will say, Shashidharan, the gate opens, I am inside. So soon we're going to see all this in the 21st century. Ladies and gentlemen, put your hands together for the beautiful session on this. I request the chairman session to present the mementos to the distinguished speakers, to Sri Atul Kumar Singh, Additional Director, Software Technology, Park of India. Thank you, Atul ji. Joining us from STPI. Let the clap continue. Huh? I know you all are hungry, so we'll move into the lunch now. Next is Mukesh ji, Mukesh Sharma, the Regional Head Northeast Alcatel Lucent Enterprise. Third, Saurabh Agrawal, see your tech bridge, whom I forgotten in the initial this thing. Saurabh is a good friend, so he won't mind. सौरभ बड़ा दिल वाला है, तो दिल इतना बड़ा है कि कोई भी सेशन में बुला लीजिए बोल लेगा. Thank you, Saurabh. And then Dr. Bhupender Solanki, Assistant Professor, Department of Pharmacology on the AIMS, Rishikesh. Thank you very much for traveling from Rishikesh to all the way here. And the man cyber security, here you go, Vivek Gupta. Ladies and gentlemen, put a hands together in Vivek Gupta. Let me join in this because I have an old association with Vivek. I request Dr. Vikas Kataria, please come on stage to present the memento to Dr. Vishal Gandhi. Dr. Vikas is from the Cardiology Department of Holy Family Hospital. आप लोगों का दिल को ठीक रखना है, डॉक्टर विकास के पास जाइए. सबका दिल देखते हैं डॉक्टर विकास. Thank you so much. Thank you so much. Let's have a group photo. Yep. So now the lunch break for 1 hour. We will be back by 2:45. Thank you. Yes. Thank you.
Atul is again Bombay, Lucknow. They all are nice in and my father was in AMC. And father-in-law also.
Small world. This is my card. And people appreciate it. Right? In the office of even I'm a UAT surgeon already. And I have a couple of colleagues, this officer who's working in IT with us. So I said, so, as one of the he's an IT officer, not an officer. So you're from which place, sir?
The dad is from Nagpur Medical College, father-in-law also.
And what was he in the
His dad is Brigadier DD of Delhi area. Then the General Shah was General Shah only Brigadier HS Gupta. He was medical specialist and rheumatologist. And father-in-law was in AFMC also. He was Brigadier PS West. He retired from 1017.
Okay. We thought we'll come and have a look at what's happening in digital health space. So nice. So we'll connect with you later as well. And you're based in Delhi?
Means it's close to my heart.
Oh, it's a family now. And are you based in Delhi? In Delhi. Fair enough. So we will take some, going into a lot of transformations, both the army, navy, both of them are having separate trust areas. And cybersecurity is something which we are always worried about. We have air-gapped networks, but one of the networks is not going to internet. It will enable HMIS as one of the internet. Blockchain technology as one of the so we are doctors, we just heard, we are not really very sure whether we do the right thing. So we will definitely connect with you.
I came to AFMS office when Suzuki was there to meet Brigadier Nayak. Ranjit.
So that's a small world again. We sit in the same office.
Yeah, same office. Yeah. I know Suzuki is also there.
Yes. We sit in the same office. And
very sad. One side he saw an appointment to Pune, the other side. I met him last week, he was here in Gurgaon. His father was not well.
like
Philips HeartStart FRX defibrillator demonstration. The Philips HeartStart FRX is designed to be an easy-to-use, rugged and reliable, automated external defibrillator designed specifically for those who get there first. This demonstration illustrates the functionality of the HeartStart FRX, including easy-to-follow voice instructions and descriptive visual icons that take you through each step of the process for both adult and infant-child defibrillation. To start the defibrillator, press the green on-off button and follow the HeartStart FRX's voice instructions.
Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
CPR should continue to be performed according to standard protocol. To initiate infant-child defibrillation, insert the infant-child key. To start the defibrillator, press the green on-off button and follow the HeartStart FRX's voice instructions.
Infant-child mode. Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the infant-child key. Peel one white pad from the gray case. Place pad in center of child's chest. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad on child's back. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. For patients less than 1 year old, use 2 fingers instead of the heel of your hand. Push the chest down firmly. Keep time with the beat. Pinch nose, tilt head, and give 2 small breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
CPR should continue to be performed according to standard protocol. Innovation and you. Philips. to the Philips HeartStart FRX defibrillator demonstration. The Philips HeartStart FRX is designed to be an easy-to-use, rugged and reliable, automated external defibrillator designed specifically for those who get there first. This demonstration illustrates the functionality of the HeartStart FRX, including easy-to-follow voice instructions and descriptive visual icons that take you through each step of the process for both adult and infant-child defibrillation. To start the defibrillator, press the green on-off button and follow the HeartStart FRX's voice instructions.
Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
CPR should continue to be performed according to standard protocol. To initiate infant-child defibrillation, insert the infant-child key. To start the defibrillator, press the green on-off button and follow the HeartStart FRX's voice instructions.
Infant-child mode. Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the infant-child key. Peel one white pad from the gray case. Place pad in center of child's chest. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad on child's back. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. For patients less than 1 year old, use 2 fingers instead of the heel of your hand. Push the chest down firmly. Keep time with the beat. Pinch nose, tilt head, and give 2 small breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
CPR should continue to be performed according to study protocol. Innovation and you, Philips.
Madam, just tell them to join us. Those who are standing behind, please, on the pillar side, please join us. Dr. Kalra, can I have the name of the student? Tushar. Once again, I request all of you, those who are standing on the pillar side, please join us. If we waste the time here, it will go till 6 o'clock. Hotel staff, let's not make too much of a sound. Good afternoon, ladies and gentlemen. We have a session 3 technical presentation, generative AI, intelligent automation in healthcare operations. The chairman of the session is Mr. Sumit Puri, CEO, Pranav Wellness. May I request the chairman to come on this? One of the oldest CIO in the hotel industry, well-reputed name. He has been in Max Health as a CIO. Now he became an entrepreneur. Ladies and gentlemen, give him a big hand because he is going to share a lot of things with us on AI. Mr. Lalit Arora, Technical Consultant, Communication Expert, Alcatel-Lucent. Professor Praveen Bis, CIO, Amrita Hospital. Dr. Suraj Srivastava, CEO, SODL Services of Diagnostic Laboratory. I just met him. Where is he? Dr. Suraj? Ranjit, can you ask Dr. Suraj to join us? Dr. Samir Singh, Group Medical Director, CK Birla Healthcare. Mr. Raj Sehgal, Business Lead Director at Gratuite Healthcare. Dr. Vishal, Director Healthcare, Galgotia University. And I also request a young student from Holy Family College of Nursing, Tushar, to join us. पुरी साहब आप थोड़ा आगे आ जाइए, बेटा इधर आ जाओ, थोड़ा उधर हो जाइए, आप लोग थोड़ा उधर आ जाइए। बल्कि इनको वहां बिठा दें बीच में, क्योंकि सबके नाम लिखे हुए हैं। नहीं, वो मैं अभी चेंज कराता हूँ। तुषार का नाम नहीं है, ये थोड़ा नाम चेंज कर लीजिए। डॉक्टर विशाल हैं ये गलगोटिया से, उधर उधर ले जाइए। ये आ गए। एक इनका तुषार का बना लीजिए. So, Chairman, over to you, sir.
Can you hear me? Great. So I guess good afternoon to all. It's not a very easy task to get everybody awake after lunch. I know it's going to be slightly tough. I'd like to thank my esteemed panel. I will be quickly covering some basics of the session that we have, and then we'll leave it over to the panelists to take it forward. If you can probably have the presentation up. Ranjit, up. Anji. Great. Yeah. Next slide. Yeah, so broadly, just to quickly give a sense of what the actual market is. $45 billion in AI in healthcare market by 2026. That's what we're expecting to have. Huge reduction that AI could cause in administration burden in hospitals. We all know the kind of challenges with the actual challenges happening in nurses, overload, and administrative burdens in hospitals, struggling to meet the requirements that are there. There is a significant accuracy issue still. Doctors are overworked also. As we know, we have to see so many patients in India especially. So there is a possibility of AI in 30% diagnostic accuracy gain, along with significant amount of traction in costs. You can reduce costs significantly, and I'll talk about that very briefly. But there is a three pillars that I'm basically talking about in this, and we'll have the panelists talking about this much more. But the fact is, clinical AI is maturing. It's becoming better and better as we go. All of us understand, we've seen how Gen AI has evolved, how chat GPTs and Geminis are actually becoming so much more accurate, so much more useful. So this is where the future is. We all know there is going to be LLMs coming up, and you'll probably have discharge summaries being written with LLMs, which is one of the biggest reasons why people sometimes don't get discharged in the morning, and until late evening, you're still waiting for the discharge to happen. So for me in Max, for example, we had the only board KPI was 75% of patients should get discharged by 12 p.m. And it was such a struggle because there were so many aspects to this that AI can solve. It can actually make it much more easier. Multimodal AI, imaging parts, we all know there is significant challenge again, in terms of this, reading of all the information, the text, and the labs together. How can you make it faster and easier? It can reduce documentation, which is one of the biggest banes for healthcare. Infrastructure. You have now private 5G-enabled infrastructure possible. And again, I'll quickly touch that as we go forward with IoT sensors, and how can you really transform the connectivity within hospitals, and how you can save lives, how you can enhance patient experience, how you can really reduce costs, all aspects which can be covered with this. There is also 30% energy saving. You can save costs around that. So business case, ultimately, if you don't have a business case, it doesn't work. And I think it'll be great to have some practitioners talk about actual business cases of what they're using Gen AI for, and how can we really make automation a reality, part of what hospitals do. So I'll not spend much time, but the fact is, there is smart infrastructure, there is data and connectivity, there is AI and automation, and there is clearly the scope to enhance revenues and reduce cost around this. RCM, and again, I have been advising, and I've spent a fair amount of time in healthcare and insurance sector, and also consulting. I can tell you that this is the main thing that hospitals want. Can we ensure we can focus on revenue cycle management? Can we ensure the billing is proper? Forget about any other, systems. Most important, HIS, because billing happens there. Now, if you can get Gen AI into RCM, where you ask a question, an operations leader or a CMO or CEO asking, why did my revenue for cardiology not happen last week? Simple question asked just like ChatGPT does, and you get the answer. You get insights. That's incredible. Now you can do that. We have tools. I've already doing it at a couple of hospitals. This is where the future is, to make it much more interactive, much more useful, much more timely. Because insightful things, when you're doing the right things at the right time, that's what yields results. You can do obviously improvement in claims. You can actually enhance the coding and documentation aspects. You can do real-time revenue, dashboards. All of this is possible today. The invisible, uncaptured value that hospitals don't even know. Uncaptured value. I can tell you 5 to 8 crores per year just lying on the table, which you're not picking up. Asset loss and write-offs. I wrote off, along with my engineering team, I won't take the number, but it is in significant double digits for assets. We had no idea where those assets were. Portable machines, X-rays, CT scans, gone. So many such assets are not even visible because inventory is a problem. We don't manage fixed assets very well. So that's again something which can be completely taken off. You can have complete visibility of portable assets while you're in the hospital. And you can optimize the usage. There is a lot that can be done on staff. Imagine porters, GDAs. I have had challenges where the porter suddenly disappears, GDAs, in our hospitals. And you don't know where they've gone. Smoke break, kahan gaye, kuch pata nahi. If you were to look at that, you can have real-time tracking of this because patients are suffering because of these. And again, aap measure karenge to manage karenge. That's the key thing. So again, that's one more aspect. Where the money actually goes, 2 to 3 crores lost revenue, 1.2 crores staff productivity loss, 1 to 2 crores asset loss, again 0.3 crores, 1.5, 10 crores just waiting to be taken up. And I'm talking about medium-sized hospitals. This is not cost cutting, it's just value discovery. Understanding how you can enhance value. There are certain solutions that I am basically working on, as in resource tracking, process automation, energy net zero, sustainable बनाना भी जरूरी है. आप ऐसे resource tracking करें, आप process automation करें, मतलब आप wireless nurse calling कर रहे हैं या automated compliance कर रहे हैं, reporting कर रहे हैं, smart washrooms, smart buildings, आप BMS के साथ connect कर सकते हैं, आपका actually speaking energy saving 30% हो जाएगा. You can save energy what you're spending today with just this. I'm giving a sense of this, just a quick sense where Gen AI creates value in healthcare. So clinical operations, revenue cycle, asset facility management, patient experience, AI-powered devices, 5G and connectivity across the board. Max is now at 24 to 30% EBITDA, as we call it, because of this data we were able to generate when I was there. In other Evercare Hospital and many others, it's about the data. It's about using the data at the right time. So I'll just say this, Gen AI, the time has come. It is not about if, it is about when. How fast can we leverage AI and create tremendous value? And that's all I'll probably say. Happy to connect and discuss more, but I'll leave it open to the panelists to take this forward. Sir, would you want to start?
Right? I think that's better.
Good afternoon, everyone. I would, I have few slides, but I would try to make it as interesting as possible, and I'll give some real examples that we are using AI in various departments, and a lot of it is still in POC. I want to be very honest and upfront about it. A lot of people talk about all the big things. Big things will happen. Like we said, not a question of whether it will or not, it's how fast. And it is catching up, but we at Amrita are doing our little bit, playing around, doing a lot of PSC, have actually implemented some of the solutions as well, but it's a long journey. And AI is definitely a lot of hype around it. We want to board this bandwagon at the earliest, but at the same time, unless and until we really plan for it, we can go in for a ride. So I just want to play that devil's advocate and say that you should all focus on AI, but with due diligence. That's very, very important. So again, I'm Professor Praveen Best. I'm the CIO with Amrita Hospital, Faridabad, and that's the maybe 3-year-old image when the hospital was getting inaugurated. And Amma is our chancellor. She's chancellor of Amrita University, Amrita Hospital. More importantly, it was inaugurated around 4 years ago by our respected Prime Minister Modi ji. And we have come a long way since then. It is one of the largest healthcare facility. The reason I am giving you some of the details is because when we talk about Gen AI implementation, it's not only on the clinical part, it's also on operational part. And being a facility of that scale, even if you can operationalize, improve the efficiency by few percentage points, it makes a big difference. So also I would like to highlight that the last point there that we had, a hospital was inaugurated, but then we have a nursing college, medical college, and now we also have engineering BTech, MTech degree, but that is focusing AI in healthcare. So just want to add that, and that is where we are getting a lot of ideas, we are getting a lot of resources to work on some of the projects that we are working on. So this is just one example. It's a medical summary, and I think sir also mentioned earlier that today we all talk about implementing AI. We also talk about having the right data, but unfortunately, we all know, we have all been to the hospital, the doctor is busy. He's really busy. He's talking to patient. He's maybe scribbling something on the piece of paper. He doesn't have time to enter that information on our EMR. So is it data lost? Yes. But with use of AI tools, we can actually use that very weakness that we have. The audio transcription, say the patient and doctors are talking, that can actually be transcribed and fed back to HIS, fed back to the EMR solution. So that gives you the data. Similarly, if something is being handwritten, that can be OCR read very, very easily now. The accuracy is, amazing. Sometimes I am not able to read, but AI is able to make out of the handwriting. I'm not kidding. It's real fact. So things have advanced. AI has really, especially in OCR, voice recognition, image recognition, it has leapfrogged. So we are able to capitalize on that advancement and then leverage whatever was the weakness earlier that we didn't have data. We're able to generate the data with using the voice, using the whatever handwritten prescriptions also. So in this particular example, it can be on a mobile app or it could be an actual desktop, laptop, where the doctor is selecting the right patient and then he is speaking to the patient as he does a consultation, and that is being recorded and it gets generated with a right summary, with the right structured data. So it's able to classify that information, that discussion. समझ लो मैं patient से कुछ generally I'm talking not necessarily something that is relevant, so AI will ignore that part because it knows it is more like I'm breaking the ice with the patient, just talking to him. But whatever relevant, including अगर मैं उससे उसकी past history की बात कर रहा हूँ, तो it will go to the past history. I'm talking about medication, it will put in the right place. So AI is able to make all that, but we all know AI is not 100% foolproof. So we finally present it to the doctor, he can quickly glance at it and he can approve the same. And this particular app that we have developed actually was launched in the AI Summit along with Bharat Gen. So if you all know, Bharat Gen and Sarvam are the two LLMs that Government of India is banking on, and Bharat Gen is is championed by IIT Bombay, and we are working with them. And there is a small video, if I can play. It's a 10-second video.
Our Bharat Gen model, tuned for medical words and Indian accents, captures English, code switching, and auto-summarizes the visit. Automated EMR mapping. No more typing, just treating. Also, you can scan your medical report. Bharat Gen AI gives instant...
So the audio is not clear, but this was launched in AI Summit, and you can see the DST secretary and the MITI secretary, they're all sitting there. And IIT Bombay, we have worked with them and then made it. Earlier we were not using BharatGen models, but now we have changed over and we are using BharatGen models. So it's able to transcribe not only English but also Hindi and many more local languages. So again, that is the power of AI. I want to just give you a glimpse of it. Next. Okay. So this is another app, and I'm not saying we are using it for clinical, diagnosis right now. It is under POC, so I want to be very upfront about it. So here what we have is a patient is able to take an image. It's more for dermatology kind of issues. And the patient is also asked to summarize what the problem is. Then the third way we are taking information is AI is able to ask some relevant question to the patient. So there are three information I'm getting. One is the image of the patient. Second, he's explaining his problem. Third, based on the problem, I am, as an LLM, trying to ask some relevant questions. So I am getting data in three ways. So what we have done is we are able to analyze the image and able to give some diagnosis. We are able to analyze what information he has given based on the expert system we have developed with the input of our doctors. So they would have said, okay, if a patient is talking about this, the percentage of having such a diagnosis is so much. So there is like a complex matrix that we have developed. So based on that information, again, system is able to give some percentage probability. And third is based on the conversation he had with LMM. So actually, you can compare all three. So when a patient walks into the doctor's chamber, doctor is able to see all this information upfront. So obviously, he will do the needful, but he is able to be presented with a lot of good information which he can use to do a better diagnosis, and it can definitely help. And this is a little bit more details of it, but in the interest of time, I'll skip to the next slide. This is another one of the application where we are using in community for mouth ulcers, which could be cancerous also. So a remote place, they just use a mobile phone, take a photograph of their mouth. It may not be a best photograph. We all know there are challenges with respect to, especially if the lesion is inside the mouth. But with whatever best capability they are able to take, and we are able to use that information with basic image analysis as well as some of the information that we capture for the patient. So a lot of this is happening in remote areas, and with the help of mobile app, we are able to capture a lot of good information. Again, not for clinical diagnosis, but it's able to help the clinician make a better decision. But hoping with further fine tuning, and if we're able to do see the good efficacy and accuracy of this model, we'll actually go for its usage also. The third important factor that probably we all have heard news where how mental health is negatively affected because of use of tools, screen time, so on and so forth. But at the same time, it has been proven that a person, especially young adult, if they are suffering from the mental disorder, they are more likelihood of sharing that with a bot as opposed to another human, because of whatever stigma reasons and other reasons that they don't want to explain, share their problems, but they're able to do that with a bot, knowing that that bot is not going to misuse that information. And we have seen this over and over again. So we are also working on a lot of issues where we will to prescribe some important content that we are actually showing back to the users to improve his mental condition. Again, this is another one of those tools that is under evaluation. And then the previous speaker mentioned about revenue cycle management. Can't stress enough how critical, how important is revenue cycle management. And we are also having a solution wherein we are able to scan the different documents the patient brings in, whether it be it Aadhaar card, be it an insurance card, and based on that, we are able to do OCR of what is there, and we are able to complete the generation of different documents, including whatever has to be used for submission. So it has really, really reduced our time drastically and reduce the errors as well. So again, this just shows how AI can be used not only in clinical setting, but also in administration and operational reasons. And this is another example. We have automated our purchase process altogether, wherein we are able to get the inventory information. From inventory, we are able to decide the purchase requisition. From purchase requisition, we are able to generate the purchase order and also email it back to the vendor or the manufacturer as the case need be. So all this is being automated. So what it used to do, we used to take Monday as the starting day, and our weekly work would take almost 3-4 days. So by the time you are on Thursday, you are actually already ready to manually work on Monday again for the next cycle. So this has reduced that 4-day window into maybe a couple of hours. That is all. So on Monday itself, not only our POs are generated, they are already sent to the vendors, and we are seeing a tremendous gain in terms of productivity, operationalization, no errors. So it has made a big difference. And similarly, we are working with different departments in our hospital, both clinical and non-clinical, to see the gains. And like I said, the scale of the hospital being so big, even a small difference is able to give us valued multiple times. It's able to give us the value. And then similarly, we are also improving how do we schedule operation theater. We all know it's one of the very, very resource intensive and a bottleneck operation when it comes to the entire management of inpatient care. So OT scheduling has been a challenging job, and we're able to again use AI to look at the past data, how things have been, and improvise on it and be able to predict and give a better schedule for tomorrow's surgeries that are planned. So I would, I only used 13 minutes of the allocated 15 minutes, so I have 2 minutes. If you have any questions, I can take now or towards the end of the session. Thank you so much. I'll wait for the person to stand up. Musical chair. So, Lalit probably is the next person. Please. Thank you, sir.
Hello. Good afternoon, everybody. You heard from my colleague, Mr. Mukesh, earlier regarding who we are and what we do. I'll take it forward from there, and I'll be focusing upon what ALA can do in the healthcare sector, and specifically on the future-ready smart hospitals. Okay, how we can optimize the care pathway for better outcomes. So we start with the healthcare trends, but prior to that, I would like to say that ALE doesn't only make technology. It doesn't sell technology. What it does, it monitors very closely the ongoing trends, and based upon that, fine-tunes the solutions and gets ready to deliver the challenges faced by this market. Let's see a bit of the trends. So this slide indicates a global health survey done by Deloitte in 2025, wherein it states that the healthcare leadership as of now is focusing upon solutions which are efficient, which are ready to deliver patient care, and ready to be progressive. So let's go through these aspects one by one. So we start with the digital transformation. Okay, so digital transformation is a trend. Okay, and most of the hospital sector as of now is pushing onto it. So most of the hospital sector as of now is embracing the digital technologies. And now digital technologies, when we talk about digital technologies, cybersecurity cannot be ignored. Okay, cybersecurity is the foundation. Okay, so this trend indicates that we have to enhance cybersecurity as a priority. The other trend, which is related to the improved patient experience, engagement and trust. That makes sense. We have to improve our solutions in order to deliver the right patient experience. Another one is the virtual care. Now, to make the healthcare more accessible and to slash or reduce the wait times, virtual care makes sense. The concepts of virtual care, hospital at home are gearing up as of now. Another trend which we see is drive efficiencies. Okay, so the hospital staff, when equipped with the right tools, right strategies, you can derive efficiencies so that this staff can concentrate more upon their core work, that is patient care. And last but not the least, one of the trends says there's a global shortfall in healthcare sector. So we have to address that. Most of the organizations will be, in fact, spending more and more in terms of, in the form of workforce retention. Okay, so we need to find some solutions which can reduce the burnout of the staff and we can retain them. Now here, how ALE can bridge the gap. This we will see in the upcoming slides, like we have a value proposition and how we translate these trends into our value proposition and deliver solutions. I'll go through that. So in terms of our value proposition, we have 3 pillars. We start with the healing patient experience. This particular pillar is concentrated or revolves around the patient care, okay, the patient experience. The other aspect which we have, the second pillar, is the redefined care delivery. This particular pillar addresses the clinical staff, the doctors, the nurses, how we can make them more efficient. And the third, but not the last, is the efficiency, safety, security, privacy, which in fact relates to the hospital infrastructure. How can we meet these 3 value propositions? We cannot just say and meet them. We need a backbone for that. We need an architecture for that. And for that, we have in our proposition resilient network architectures, resilient communication architectures, coupled with solutions like location services, collaboration services, and last but not the least, the workflow, the service workflow. So we have solutions via which we can deliver our value propositions and translate them into the trends which we are seeing as of now. So let us see these value propositions one by one. So we start with the healing patient experience. As I said, it revolves around the patient experience. So the need is to capture the entire journey of the patient. The first interaction with the hospital to the day he leaves the hospital. And we can help you out that. We can help you with our communication solutions, the first touch which the patient has with the hospital. So he can be given professional greetings, okay? He can be given various medias to reach the hospital. It might be an audio call, or it might be reaching the contact center via other medias like email, social platforms like WhatsApp, Twitter, okay? And you can even, we have the functionality or we have the capability to integrate this functionality into your hospital web page, okay? So the patient will just visit your web page and from there you can give the options to the patient to reach the hospital, okay? It might be in the form of a chat, might be a form of audio call, might be a form of video call, okay? So that level of integration we can do. Now once the patient is staying in the hospital, yes, we have solutions how we can enhance his experience, okay? Say for example, a patient bed can be equipped with a phone, okay? It can be a normal analog phone, or maybe keeping the hygiene part in perspective, it can be a phone with antibacterial properties, okay? So we have an ecosystem with which we work, which have some validated phones which are antibacterial, okay, perfectly, which can be positioned in the hospitality market. And then if the patient is VIP, we have state-of-the-art phones, okay, which you can customize, in fact, and have the ambience or the aura of your hotel positioned to that. So that gives a different experience to the patient. Another aspect which we can enhance the patient experience while on the stay is that via the web portal of your hospital, okay, why not give them the aspect how they can call the various hospital infrastructures, okay. So via the web portal which they will access, you can give them the options to reach anywhere in the hospital or even reach their families via doing an audio call or a video call. So once the patient is discharged, okay, so see, we are a company who provide communication networking solutions, but we also have solutions via which we tend to bridge the gap between what the expectations are in the market. But we don't supply each and every component of the healthcare, okay? So this is important for you to understand, okay? So like, for example, in the post-discharge follow-up, what we do, we deliver a specific API, okay? So for your the operative follow-ups, okay, for these management applications can be integrated by the API to give you this post-discharge follow-up experience to the patient. Next pillar which we have is redefining the care delivery. As I said, that this one is concentrated upon the healthcare staff, okay, the staff that comprises of the clinical staff, the doctors and the nurses. So how can we enhance their experience? How can we make them more productive? The firstly is equipping them with the right solution, okay? If the staff is desk-bound, okay, he can be equipped with the right phone. If the staff is mobile, he can be equipped with a mobile device so that anywhere in the hospital network, he can be there and reachable, okay? These mobile staff can even also be equipped with collaborative applications so that they can collaborate between each other, okay? So such sort of experiences we can offer to the care delivery team so that they can be more productive. So this is an example. So we have an application called Rainbow, okay, which is cloud-based but can also be installed on-premise. So this is fully GDPR compliant. GDPR means like this is fully data protected. 100% data privacy is guaranteed here. We being a European country, we comply with this GDPR compliance. Unlike the other OEMs, which are US-based, say for example, they are governed by the US IT Act. So what they do, like for the US IT Act, the federal government, it can take out the data, pull out data as per their need. But this is not the case in case of the European manufacturer or the European country hosting the cloud solution where your data is fully guaranteed in terms of privacy. Okay, so this is an example. If you see in the center, okay, so here is an example how we can use this collaborative application in terms of the patient perspective. Okay, so the healthcare worker can connect with the patient and offer telemedicine utility. Okay, and on your right, if you see, this is something for the staff, wherein the staff member can pull out EMR records. Okay, so we can offer you the integration with the EMR database, so that as and when required on the fly, a doctor or nurse can fetch out the data, do the modification if required. He need not use a couple of more tools, in fact, to firstly go and access the EMR with one media and then take it forward with another media. With a single media, with a single device, he can fetch the EMR records and serve the purpose. And on the right side, we see they are smart buildings. Okay, so we can integrate IoTs, we can monitor the IoTs, we have solutions for asset tracking and people tracking. Okay, so all these things make the life of a care staff much simpler, and it gives them the room to be more productive and concentrate on the core job, that is patient care. So we also have in our offering the Wi-Fi access points, which can give you the coverage for a campus for the Wi-Fi. Okay, so we have Wi-Fi 6, Wi-Fi 7, which are high-speed networks. Okay, so the users can be anywhere. Okay, so they can roam around the campus and leverage the flexibility so they can be connected. The third pillar which we have is the efficiency, safety, and security privacy. This, as I said, it is for the hospitality infrastructure. So let us see how it does. So we have, firstly, the backbone. So we have solutions to give you the very efficient, resilient backbone in terms of networks, in terms of communications. And we have the capability, as I said, to integrate IoT devices also. Okay? Further moving that, we have solutions wherein we can centralize and gather the notifications from various devices. And from that central location, we can move further and then broadcast them. Okay? It can be multi-channel broadcast via the email, broadcast, audio broadcast via the IM. So via this, we can move forward. So the nutshell is that we help you to connect your patients, staff, and healthcare ecosystem. Okay. Why Alcatel-Lucent? Because we understand the market very well. Okay. And here, if you see, this is the communication solution for hospitals. Here, what we have done, the value propositions, what we have done, we have just discussed. Against each value proposition, we have a solution. And as you know now, our value proposition, it translates to the current requirements, the current trends. So this makes the positioning of a solution much more effective. Okay. Say, for example, for healing patient experience, we have attendant solutions. For redefined care delivery, we have UCAS and CPaaS solutions. And for efficiencies, security, privacy, again, we address it by the CPaaS. Similarly, we have resilient network solutions, okay, which support high availability also. And with this, we can do secure onboarding of the IT devices, and we can address this safety part, security part, and privacy part. So in a nutshell, with decades of our engagement and decades of innovation, and recognized by the healthcare institutions, and also being an ecosystem contributor for connectivity and collaboration, we, Alcatel Enterprise, are the right partner for connectivity and collaboration in healthcare. Thank you very much.
Thank you, Lalaji. So again, we've covered all the key aspects, patients also of, for hospital administrators and management, as well as, the people who are basically the clinicians and staff. So safety aspect as well. So thank you so much. I'd now like to request Dr. Suraj to probably come and speak. Thank you.
That's not working. Hello. Very warm good afternoon to all the distinguished speakers and all of the guests. Well, I will stick to the topic which we have, and of course, in terms of the transformation of generative AI and intelligent automation. Well, let me start with a simple question. Have we ever gone to a hospital where we are asking for the informations again and again? We talk about name, age, history, reports, all of the informations again and again. And it is still happening. Why? The main reason of this entire situation where, we tend to ask the same questions again and again, the simple answer is because of the implementation is not correctly being done when it comes to generative AI. Healthcare in India is still improving, but still there are few points where we need to, absolutely taking care of it, that the datas are disconnected, reports are scattered. When it comes to doctors, they are able to see the, long reports and they're not able to get the summarized reports. When it comes to the patient, they are also somewhere confused that whether they are getting the correct information or not. The problem when it comes to healthcare industry, it's not only centered to the hospitals, but it is to the labs as well. Because there are too much of manual work, too much of repetitive, written work, what we are doing currently. Now the good news is that India has already started building their digital health system, which is ABDM, Ayushman Bharat. And because of ABDM, now it's really helpful for not only to the patients, but also hospitals and lab are also connected. Now when it comes to the patient, every patient can get the ABHA ID. Not only that, records and it can be stored and shared digitally as well. Also, as I said, that the hospital and labs can be connected very easily with the ABHA integration. So that is a point where Indian government is it's a great initiative. We all should appreciate that initiative. Not only that, other hand, Indian government has came up with the initiative which is eSanjeevani. Let's talk about eSanjeevani. I'm sure 95% of people and distinguished guests, they know that what it is. However, just to let you know that it's a telemedicine platform where the second part, when the ABHA integration, the patients are getting their report, everything is done. The second part is done by eSanjeevani, where patients can consult the doctors online. And that is, of course, a great initiative by the Indian government. However, currently when we talk about ABHA integration plus the eSanjeevani, because of this, healthcare is reaching people instead of people chasing healthcare. But still something is missing. If we talk about when it comes, both are available. But what about the speed, intelligence, smart decision taking? There comes the generative AI and intelligent automation. Let me make it very simple. Generative AI, that is something which can understand, analyze, and put few of the data in such a way that it is easy for fast decision making for the doctors, even for the pathologist when it comes to the diagnostics laboratory. Talking about not only the AI generative, but with the AI automation, it can reduce the workload, it can reduce the errors, and also it can help doctors to see the summarized report. Where they were getting the entire report, a long report, it can easily summarize it. So definitely, it's a point where it's a great initiative by the government too, and of course, we are moving faster with AI. Imagine a patient gets a blood test done. Now see that what this great initiative is actually doing when it comes to patients, those are actually in tier 3 and tier 4 cities. So as I said, that let's say that a patient gets a blood test done, the reports are being uploaded via ABHA integration. Then AI checks and highlights the risks, that how it is. And at that time, doctor sees a summarized report instead of the long reports. And then another part comes when it comes to eSanjeevani. Post, when the patients are getting their reports, it is being checked by the doctors, they can do the follow-up via eSanjeevani. And that is actually a great initiative. That way, we have faster care, better care, and a smarter care. Of course, with AI automation, waiting reduces. Staff becomes more productive when it comes to hospitals as well as in diagnostics laboratory. Because, putting the entire information from the analyzer to the limb system, if the limbs is not connected, if repetitive informations are being put, because sometimes doctors are also overloaded when it comes to the pathology report. So that way, where it is being told that when they'll see the summarized report, even if the AI can generate certain summarize that what they should take, what are the preventive cares that they should take, then of course they will be more satisfied too. In this way, hospital and diagnostics are not going to be treating the patients better, but they are going to run better. And that way, the startup, the tech startup, the healthcare startups, it is going to boost, not only boost their economy, but also it is going to boost the, when it comes to connecting the patients and connecting the doctors too. Let me share one very important thought. We have been hearing this in so long that AI is going to replace doctors and healthcare professionals. Let me tell you, AI is not going to replace the healthcare professional or the doctors, but people, those who are going to use AI, definitely they will move faster than people who don't. So, of course, the initiative when it comes to AI and the intelligent automation with any organization, whether it is hospital, whether it's government entities, and I'm really thankful to the STPI and Bharat Exhibition for this great initiative where you gathered all of the tech innovators and industry leaders as well as tech innovators too. Well, as leaders, our job is not to adopt technology. Our job is to build a system that can work for people. India is in a very strong position today where ABDM is building foundation, eSanjeevani is expanding access in tier 3, tier 4 cities, and AI is adding intelligence. If we bring all together, we can make healthcare smarter, faster, and more accessible to everyone. We talk about tier 3 and tier 4 cities. We are talking about AI, we are talking about intelligent automation. But whenever we are talking about tier 3 and tier 4 cities, their affordability is not the necessity. When it comes to hospital, when it comes to labs, their affordability is our responsibility. Because if, obviously, when it comes to generative AI and automation, it is being implemented in the lab and hospital, somewhere down the line it is going to increase the expenses too. But when it comes to tier 3, tier 4 cities, our responsibility is to implement the AI and the automation in such a way where it is needed for logistic from end-to-end process, end-to-end. Because if the diagnostics or if the healthcare, it is going to be more expensive, people will delay testing. People will delay, going to those hospitals where the bills are in such a way that, they are not able to afford it. So of course, down the line, our responsibility really matters in terms of implementing generative AI and intelligent automation. Well, I would like to thank you once again, to Bharat Exhibition, Mr. Shashidharan, and all of the distinguished speakers, guests, and tech innovators and tech partners too, for this great initiative, a great platform to gather all of us and speak about something which has to be needed, it has to be done, and it has to be implemented in such a way that it is not only fulfilling the requirements, but also educating people, not only to tier 1, tier 2 cities, but also tier 3, tier 4 cities as well. Well, thank you so much, and thank you for giving this opportunity.
Thank you, Dr. Suraj. I think, again, very rightly said, faster, smarter, and more accessible to people. That's what healthcare should do. So brilliant, brilliant exposition there. Lots of very interesting things to look at, even for remote access in general. I'd now like to request Dr. Samir to basically come on the stage.
Hi. A very good afternoon to all of you. Thank you, Suraj. It always helps if there's a good-looking person is able to sit down here and attract the audience's attention back to the podium. And Sumit sir, you actually led the way to this. So thank you, first of all, Bharat Exhibitions, for inviting me again. I remember last year when we came down here, there was Miss Upasana Arora, who I very fondly remember what she said. She said she would prefer natural stupidity or foolishness over artificial intelligence any day. And that is how I think it resonated in the last 1 year. I happened to visit an exhibition, which is the largest healthcare exhibition in the world at Dubai. And we were literally paralyzed by the amount of AI is there in each domain, specifically radiology, medical equipments, devices, that whatever probably we are coming up with 3 more hospitals. I'm the group medical head for CK Birla group of hospitals. So we are coming with 3 more hospitals, almost doubling up each hospital, which is in different geographies where we operate out of. So all the purchases have to be redone. And what we bought 5 years, 4 years back, the decisions which influenced us, especially into medical technology, that's got completely changed by AI. And it's not the regular player, the branded ones which you see, off the rack available in every hospital. We had to make our choices from the emerging new players or the older ones who have revamped themselves with, AI technology driven into, what do you call, Okay, all right. So what we were thinking AI has been so there's a very fine line between the yo generation AI yo and calling IO from the kind of paralysis it gives you. So what for me AI powered is, it means the system has used machine learning data and historical algorithms to predict something which is almost nearly accurate. Nobody can claim to be 100%, 99, 96. As long as it's also 93, 94% accurate, it's better than a clinician's diagnosis in all probability. So what's the scope of usage? I think you've been hearing speakers since morning. There are a lot of presentations from here. There are a lot of demos going on. I think I'm also going to speak on some of them. So few in healthcare, what it serves is it targets to improve diagnosis, treatment, and patient monitoring. So these are the 3 key areas. And where it starts from, I think a couple of our speakers also spoke. Mr. Lalit spoke before that. Somebody else also spoke about preventive health check, catching up patients very early. Before preventive, it is called as primordial healthcare in community medicine language. You catch when you're not even expecting, and it's actually knocking on your doors. So you'll see in preventive health check, then there is differential diagnosis, then eventually into diagnostics, and finally into how the treatment is being offered at IP, home care, or follow-up settings. So what it works into preventive healthcare is it starts giving, as Suraj rightly said, it prompts for blood tests. So we were at Manipal in Bangalore, putting up a completely digital hospital. We were evaluating a tool where if you have searched for an ENT doctor on your any app or any internet, and your vehicle happens to cross within 100 meters of Manipal hospital, it will prompt you that today the ENT surgeon's OPD right now for so-and-so doctor is busy, should I book it in next 3 minutes? It's got nothing to do in our hospital. Right, but imagine the amount of AI power that it will track you, that what were you searching for, and how Blinkit and how the different grocery users prompts you on what to use, what to buy. It also tell you there's a healthcare service available right now as you cross. right? And I think it didn't fly, but then that was a good, I think, proposition which we were evaluating. It was also trying to direct you into the hospital in various 10, 11 floors which we were operating out of. Also, it could tell you when you get out of the doctor's chamber that if you have got a diagnostic test written for medicines, lab, radiology, it will tell you which department you should go first, because this is going to be an approximate waiting time. So if I know I have a third waiting time in my radiology and 14 in pharmacy, I will still get my medicines before the radiology, because these are the other two procedures in queue and this is the expected time. That's the level of AI that had gone into my operating devices. That is before the patient even steps into my care continuum, right? We also spoke about, how would you refill your medicines? It will prompt you to buy new medicines. You were looking at something in weight loss. Depending on what reels you are watching, what YouTube shorts which you're seeing, I keep getting there is a new generic being developed on anti-obesity drug. And I said, I've never even searched on it, right? So that's the level of, I think, preventive health check it is stepped in. It will obviously help you in remote monitoring. You obviously have these body health, body attached devices like these Holter monitoring, which is for ages now. You have these watches, armlets, and so on and so forth, inserted devices. What it helps in differential diagnosis is you have now these decision-making tools. I remember, I think 10, 12 years back, Watson by Oncology, IBM, had launched a disease, you could tell which kind of a onco drug will work on which patient based on the profile. Didn't really take it off very well in India because of the demographic details. It was based in Europe, etc. Very expensive tool. But a lot of now, I think, AI-based service providers are using that technology to give you a prompt on what decision, probably would be the differential diagnosis of the patient, which is also now called as a clinical decision support system. You have a lot of these various databases. Some of them are medical journals like Elsevier's to Up to Date, etc., which will help you that a certain profile of a patient with certain presentation in this particular age group, from a certain race in a particular area or a demography, will probably lead up to this diagnosis. So in case if you're missing in some critical differential diagnosis, although if it is rare one, that differential is being filled in by AI. And of course, there's this telehistopathology. We have also seen in Dubai, I forgot to mention here, we were doing a program on cervical screening, which will typically allow us to do about 20, 25, I think, young women and girls in a day, if it is a full throttle program. There were cameras, small, smaller than a radio box, which I think had some histopathology screening AI tool embedded, which will just click a picture and tell you what's your probability of having a cervical cancer and then whether you are eligible for immunization or not. Now imagine if my work is reduced to 1/8. Instead of 25 young girls a day, I can do actually 200 per center. And imagine the amount of volume of people which will benefit of it. So that's the differential diagnosis. Under diagnostics, I need not go greater details. AI is huge into radiology. I'll talk about later on how much is radiology being impacted with AI tools. It also speaks about USG handheld devices, endoscopy tube pathways. So whether it's a bronchoscopy, endoscopy, it will actually tell you what's going to be the possible diagnosis, what is the thing which you need to pick up, is this something based on the reports. That is presently being evaluated. So there are a lot of clinical trials happening on COPD using bronchoscopy and developing the pathways for further disease management as a whole in terms of clinical trials. And of course, then there is the care pathways, which is the treatment and the care plan. So I think a lot of people have spoken about monitoring, based on monitoring, developing care pathways, monitoring devices, follow-up, home care follow-ups, etc. So interesting facts that there are about 1,400 AI-powered products are now authorized by the FDA. 40% of which, about 38 to 40% of which are primarily in radiology, enhancing imaging analysis. 30% of them are in the space of monitoring, either at home or your inpatient setting, etc., including the power wearables for real-time vital monitoring. I'm sure quite a lot of you are also wearing those devices which monitors your vitals and healthcare, health outputs. New generation ones now even guide robotic surgeries And in fact, healthcare data is the new oil for which I think most of the companies vie for. So I will not bore you with greater details. I think I'll talk about key areas of AI medical device application. Of course, one is diagnostic imaging radiology. What they essentially do is either they reconstruct images when the patient is on couch, or they can reconstruct imaging when the patient is even out of the couch. Now that's the level where it has come down to. So you may go and the doctor will say, I am not finding the picture very clear, or could you change the angle? Without calling the patient back in, the AI could generate that. That's the power of diagnostic imaging. It analyzes CT scans, MRIs, X-rays to detect anomalies like plaques, blockages, tumors, even often identifying issues missed by the human eye or by the, digital tool earlier on. Cath labs may soon reduce the need for cardiac surgery, while ever-evolving CT scans has already started replacing cath lab procedures. Radiation therapy, we made a choice. In CK Birla, we are procuring the second of its kind, radiation oncology equipment, where AI will predict if your treatment response is correct by the patient. So there are some treatment goals given by when planning the treatment plan. And before every cycle, when you take a CT or an image, it tells you whether the patient has responded to at least 70% of your treatment goals. If not, you will have to replan. So typically, all the providers replan taking 24 to 48 hours. Now, there are technologies available when the patient is on couch, and a complete replanning can be done in less than 22 minutes. So that's the level of, I think, technology. It's evolving only because of the AI. We've spoken, I think, enough on wearables and continuous monitoring, so I will keep it at that. Special work is on insulin delivery models. I'd like to talk about robotic surgery, of course, where it are AI-powered robots. So there's a difference between robotic surgery and where robot kind of, helps the surgeon by enhancing precision and control during complex procedures by reducing risks. So when we say a robot is in the hands of surgeons, now the time has come where slightly the robots also have started controlling the surgeons. Of course, there's a product available here which is on digital stethoscopes and diagnostics. Please make a visit to the kiosk. I did look into it pretty well. I wasn't aware if these things are available in India. So what's the challenge here is, how do we regulate it? So regulatory framework first is phase one, where an early AI is just being developed. Second is, it starts getting into regularization. You start getting data where you start validating it. Then it starts getting slowly integrated into healthcare. See, you also understand any AI tool, it will be very difficult to implement straight away where you're playing with lives. So especially for AI in any other service industry is easily acceptable. I think after financial ones, the strictest, I think, regulations is in healthcare as when it comes to AI usage. Phase 4 is about advanced regulations and ethical framework. So where do I consider, I think in one of the following sessions, we are also going to talk about how is the ethical consideration done when we're evaluating technology. So we'll speak a little bit more about that then. Phase 5 is eventually when the future of AI in healthcare, personalized medicine, and global impact is integrated together in one go. So how we are regulating it? Of course, the first, and I think the leaders or the pioneers in regulating this is the FDA authorization. The volume of authorized devices shows a significant growth. I just mentioned 1,400 plus, with a growing focus on SAMD, which is software as a medical device, and that's an acceptable norm nowadays. So you'll find a lot. I know a spine surgeon who works with somebody in Microsoft and has developed a 3D vertebra. So I don't know whether to call him an engineer or a doctor anymore, and he still practices surgeries but works like an engineer. Then there are regulatory sandboxes. Especially mentionable here is the UK's AI airlock, which is redefining how AI diagnostics are authorized, addressing regulatory challenges. Also, NABH is making quite a sincere attempt to certify some of the products here in India, and I think that's a really commendable one since I happen to be one of the members in the panel. And of course, in the growth markets, a global AI healthcare market is growing rapidly with significant I think investments, which is helping into accelerating medical imaging reconstructions, and of course, AI-based clinical trials. So possibilities are endless. Have you started your digital health journey yet? If not, this is the right time. Thank you again, Bharat Exhibition and panelists, to give me this opportunity.
Thank you so much, Dr. Sameer. Very, very interesting. I think, also thought-provoking. So clearly also aspect saying data is the new all, and Dr. Sameer talked about IBM Watson, and I was recollecting, IBM Watson, we tried this 10 years ago in Max, and that time it wasn't ready. The data wasn't ready, and we had a challenge. And ultimately, we had so much data in Max that we were able to train the AI models of IBM Watson on oncology on a particular segment. And when it became really useful, for that particular segment, IBM Watson said, basically, I'd like to charge you X amount of money. And we said, we can't afford this much.
So you were smart to leave that, sir.
Totally.
And we were silly enough to buy it and lose a lot of money.
Okay. But there's a significant opportunity for India, given where we are, the kind of data we have. If we actually leverage that very well, there's huge opportunity. As Dr. Sameer also mentioned, there is possibilities endless. How do we really leverage it? What do we do about it is the important thing. Maybe regulatory sandboxes using data and exploring that. So thank you so much, Dr. Sameer. Mr. Raj, you're next. Thank you.
So good afternoon, everyone. I think overwhelming is the word I should use. What I heard from Dr. Sameer and the earlier presenters. A lot of enthusiasm, lot of buzzword. AI is actually one of the most talked about topic in healthcare today. Since morning we have been talking about it. It's talked in all vendor discussions, client meetings, pitch decks, everywhere. But the real question is, are we seeing the real impact or is it just hype? I think that's the topic which we are going to discuss, and I'll try to separate that, what AI is promising and what is actually working on the ground. So we talk about the promise versus reality. When AI came into diagnostic, there was a huge excitement. It is even today. People believed AI will replace doctors and things would be super fast, healthcare will be completely transformed. There were misconceptions too, mixing it with automation. But in reality, things were not that simple. When labs and hospitals tried to implement AI, it was harder than expected. The data was not available. Results were not always perfect, and scaling was a challenge. So this gap between promise and the reality created confusion, and that created even doubt about AI investments being done. So let's talk about 4 critical reasons why AI fails in diagnostic. I've picked up diagnostic as a specialized field here. First, we would talk about, a scenario where every diagnostic center who is picking up AI as a solution, they are just picking up whatever is available in the market. Rather than looking at the need gap, what exactly their institution might need, they are not very well aware about that. They are just buying the solutions which are ready-made available. Somebody comes, pitches, and they buy it. So that's the thing which is happening, and that is the reason why it's not getting successful. Second, AI is not integrated into the daily workflow. There are separate tools which are available, and they are not, in sync with, say, for example, LIMS, etc. So it's happening in some of the cases. Third, there is no clear ownership. The IT department implements it, but clinical or business teams don't use it. Fourth, there is no one tracking the actual ROI. So the AI becomes just a tool, not a solution. But there is a good news. The good news is actually the AI is already working, but only in specific area where it is used correctly. We can see the real impact in reporting and turnaround time. We can also see good impact in early detection, as we discussed about radiology specifically, demand forecasting, personalized health packages, and in lab operations. So we can certainly confidently say AI is not failing, it is just being used incorrectly in some of the cases. So as per the recent NVIDIA survey, the rate of adoption of AI by healthcare organization, which was 63% in 2024, has reached now to 70%. So of course, it's a study which is having all the worldwide countries, UK, US, etc. also. So there is a mindset shift happening. Earlier, people thought AI will replace doctors. Now we understand AI works better as an amplifier, not as a replacement. It improves accuracy, speed, decision making, but it still needs human expertise. Now we will talk about the real world impact. We'll talk about medical imaging revolution as was being discussed. We all agree one of the strongest area where AI is working is medical imaging. AI can now analyze X-rays, CT scan, MRIs, and detect abnormalities much faster. For example, lung cancer screening, stroke detection, and cardiac abnormalities. AI helps in early detection and reduces workload on radiologists. It ensures that important findings are not missed. Now we'll talk about the real-world impact, pathology and genomics revolution. Let's look at pathology, genomics and predictive analysis. In pathology, traditionally slides were viewed under a microscope. They still even are being used that way. But now the slides are digitized and the AI analyzes them like a second expert. In genomics, each test generates millions of data points. AI helps by comparing DNA with global databases, identifying the mutations, and suggesting clinical reference. In predictive analysis, AI uses past and current data to predict diseases and predict even the business demand. This is where AI becomes strategic, not just diagnostic. We'll talk about operational efficiency and business impact. Let's talk about mainly business impact, which is increasing test volumes, better upselling through recommendations, and better demand generations. I have seen some of the diagnostic centers already using a recommendation engine where when somebody comes for a registration, the AI agent pops up and says, okay, this is the relevant test which is very close to what is being ordered, so you can also upsell it. So I think that's a good use in business case. It also improves operations in scheduling, in documentation, in billing, and finally reduces manual effort. So we see that AI is not just improving clinical side of labs, it is improving business performance too. If we see an ideal use case, and that to an imaging center, let's look at the simple use case. The scenario is a mid-size imaging center implementing AI in radiology. So what's happening? The throughput is increased, better accuracy, reduced cost, and increased revenue. We can clearly look at, and the final outcome is the same infrastructure, but better outcomes. So basically, I am myself into healthcare consulting business, and I largely work with diagnostic centers and small mid-sized hospitals. So I thought, how can I help my clients? How can I use AI in my consulting business? And that's when I discovered two very small use cases. I'll just discuss and touch upon on that. So we created AI-powered smart scan. At Gratitude Healthcare, we have applied AI in a very practical way, actually. We created AI-powered smart scan. The input was a simple web form where the promoter or the CEO or the management team were filling in some basic details about the business, the available resources, and what they are doing for their business. And then AI would analyze the business performance and gaps, if any, and finally generate the report and recommendations. Of course, there was a intervention of the domain expert also, who would look at the output being generated by the AI and modify the same according to his wisdom. And finally, the outcome is that we get 360-degree view of the business. We get to see the SWOT analysis of the same client, what they are doing, what are the strengths, weakness, opportunities, threats, and what is the growth plan for next 6 months, for next 12 months, what all things can be done. It would identify hidden gaps and growth opportunities and enable faster and data-driven decision making. So that was one small use case which I used in my business. A similar small thing which I used for my couple of clients is lab data intelligence system. So what we did was, we all know every diagnostic center is sitting on a large number of data. So somebody is, for example, 5 years old, they have 5 years data in form of PDF reports or maybe in system. So most lab data is unstructured, mainly in PDF reports. We created a very small system which extracts data from reports. It organizes it, does indexing, and generates insights as per the query done. So for example, somebody wants to know how many patients out of 18,000 patients done in last 1 year were having diabetes as well as, say, if not hypertension, some high cholesterol. So the tool will give the numbers with a classification also. In short, the outcome is the raw data becomes actionable intelligence for both sides. From the clinical side also, doctors can use it, and for the business side also, people, the promoters can use it in their own benefit. So the final closing from my side is that I'll close with one thought which I'm resonating with the earlier speakers, that AI will never replace doctors or diagnostics labs, but labs that will use AI will replace those who don't use AI in the long run. That's the message from my side. Thank you.
Thank you. Thank you, Mr. Raj. Again, very interesting talk and lots of very interesting things to think about. And I guess the one thing that also stood out for me was when we talked about radiology and many other such initiatives. It is about also training the radiology, right? So in some ways, training the AI that is actually there. And that needs some patience. Very important to get that done. So to me, very beautifully explained. And there is significant adoption increase. They say 63% has moved to 70%. But how do you make that more effective for you as a hospital is the key. And that's where some level of thought, because it's not only just one more system. It is a complete ecosystem that you can create on AI per se and generate value. So thank you so much. I think we will now move to Dr. Vishal. Thank you.
Hello, good afternoon. With the sessions already running late by 30 minutes and the coffee machine's music is intermittently reminding me to finish it off, I would like to do a match fixing with you first to finish it off quickly so that all of us can take break, okay? Almost everything is already told what AI is, how we can use it, and so stalwarts were here who were holding hospitals, doing consultancy, everything. So my component is basically on something different. How we can use in transformative changes for effective utilization in our healthcare setup. So next, okay, I can do from here. Yeah. I'll just quickly run through and we'll provide you with a copy of this PPT also. Since I am also teaching in university, so students prefer कि सर आप PPT दे दीजिए हम पढ़ लेंगे exam के समय में. So I'll provide you with the PPT and then let's rush. If you have any questions at the end, we can certainly ask. My panelist and the previous panelist since morning have already covered almost everything, so hardly anything new left for me. And we know that, okay, the AI we are having the challenges like very heavy patient load in our OPDs and IPDs and other places and rising cost. And how effectively can we use AI in terms of reducing it? So we have also gone through okay, in what way AI can help us. Maybe it can do us predictive analysis. It can also help us in maybe identifying what is the lesion maybe which can go beyond a certain limit in due course of time. So a few of the things which we can also use besides what we have already discussed is the pre-authorizations for our insurance. So those of you who are already working in hospital, they must be facing this kind of challenges that once the patient is discharged and the bill is sent to the insurance company, they have some sort of rejections. So with AI, at least you can pre-check whatever bills are getting ready for that particular patient, and probably those kind of errors can be reduced. So that will help you in quicker turnaround of your patients and the quicker settling of the bill. And for the clinical workflow, probably it is definitely time saving and enhanced decisions that can help us to move faster. The ALOS, those of you who are practicing in hospital, average length of a stay will reduce phenomenally with this. Operational efficiency, definitely we have automated denials and revenue accuracy. Time reduction is a thing which is the most costliest for any hospital. So with more number of AI, as my previous speaker, Mr. Raj Sehgal, who is a good friend and a colleague, and he is an expert in diagnostics, by the way, you can reach him if you wish to enhance your diagnostics and other things. So he also suggested having AI, if mandatory for the new hospital or new clinics, then probably overall change in both government as well as private setup will be so phenomenal that the doctors will be having more time. Even somebody said in the morning that कि हमारा pathologist अभी बैठा हुआ है, लेकिन वो तो he is a MBBS doctor. He can also be used to do other things as a supportive services. So let these things come probably in next 6 months, 1 year. By the time next year we will be meeting again for the Bharat exhibition with Madam Neetu's help. We will be able to see what changes this conference has brought probably in the industry. So this is it. This is what I wanted to quickly cover. But obviously, few things. The road ahead, as I already discussed, the smarter hospitals, and we will be saving money, we will be saving time, we will be having better outcomes. And few things which I have just tried to note it down, and few of you are clicking pictures, so this PPT will be with you. In SOPs and smart patient communication and clinical documentation, AI will be certainly a greater use for all of us. Thank you. Thanks for your time. Thanks.
Thank you, Dr. Vishal. Again, keeping it short and sweet. Tushar, do you have? Okay, so I'd like to request Tushar to come in. So there's just one more session before the coffee break. So please bear with us.
So very warm good afternoon to all. Myself Tushar. I'm a PG student of Holy Family College of Nursing. I'm here to talk about AI. From the morning itself, we are knowing about AI. That AI is basically rapidly transforming healthcare by improving patient safety, enhancing clinical decision making, and reducing the burden on healthcare professionals. But from the early disease detection system to smart monitoring systems we have, AI is becoming an essential partner in modern clinical practice. But however, beyond the patient-focused applications, AI has a very important and a powerful role in supporting healthcare staff too, especially nurses, who are the backbone of the patient care in hospitals. So today, I will be introducing about my small app which is being developed and tested by me during my MSc Nursing dissertation thesis for the partial fulfillment itself, the app named as NurseCrypt. So this app is basically designed on the ISBA framework. According to the International Patient Safety Goals, goal number 2, we have use effective communication. So as per this goal number 2, we have a structured framework which is called as ISBAR. ISBAR stands for Introduction, Situation, Background, Assessment and Recommendation. This tool is being used to transfer the patient from one particular unit or even from one particular place, even from the IPD to OPD or even from one unit to the another. This tool is being used to give a proper and a complete handover of the patient. So this application, which is based upon AI, is the integration of ISBA framework with AI-powered voice-to-text solution, which is working upon to reduce the misinterpretations and reduce down the time limit of the nursing handovers. When we talk about my own app, that is NurseScript, which is being tested in the ICU, is mainly because the ICU is the place where the patient is staying up for a very longer period of time. At that moment, it is very difficult for nurses to provide a proper verbal and a note down or a pen down handovers. During that, this app helps in converting those prolonged handovers into some seconds or into some few minutes by transcribing the verbal information into a text. So mainly my app mainly focuses upon to transfer the verbal information into the textual information, which is applicable and applied in all the languages. And as per the testing, we have checked the traditional method takes around 40 to 50 minutes for giving a handover of a particular patient in the healthcare setting. But with the help of the app, it has been taken only 2 minutes, 45 seconds, or 2 minutes to 60 seconds to convert the whole transformation, the whole information, the verbal information into a textual one. With this, we have developed a proper ISBAR checklist, which is comprised of the same components, which provides the compliance of the handovers, like whether the information which is being given by the nurses are properly given to, is properly covered for all the components of the patient or not. Along with this, it provides a priority score as well. May I have a checklist, please? The second PDF. Second PDF. So this is the example of the ISBAR framework handover report, which shows you about a patient overview. About the patient overview, the primary concerns, which on what the patient was admitted to the hospital, along with the all basic demographic data of the patient, identification part, situation part. Situation part do have its own several subcomponents in it, which is required. Then we have the next component, that is background of the patient. Background, assessment part we have, and the recommendation. After this, we have a compliance checklist. This is the compliance checklist, which explains about whether the information which is being given by the nurse is properly tick marked or not. Even it says that information is given by in terms of yes or no. And at the last, it shows the patient priority on which the patient has to be kept, and along with what are the action items which are required to be done in the next shift. So with this, my app stands for time-saving, efficient, and user-friendly with good readiness of nurses and good adaptability shown by the nurses during my testing. Along with this, it has shown that effective across, the app has been effective across the diverse nurses for supporting better conversation, communication, and patient safety. Along with this, we have been in a plan to integrate the app with the hospital management information system to enhance and improve the workflow, patient safety, and quality of care. Thank you so much.
Thank you, Tushar. So again, I think really a lot of ground covered by the entire panel. So many aspects covered, and again, as Dr. Sumi said, the possibilities are endless. We clearly know that there is significant value to be unlocked. We have seen areas in radiation, 40% FDA certification actually happening. We've seen how we can help in regulatory aspects and how we can partner with government for government regulatory sandbox, and new areas which are emerging. How you can change handover from 40 minutes to 2 minutes, which to me is incredible. These are the possibilities that we all can see in front of us. I do think huge challenge, huge aspects possible in diagnostics and screening. There is a lot of early stage screening needed. So I would just say that to me, the time of AI has come. It's about us embracing it and probably training it to the best effect for our own hospitals, for our own institutions. Thank you again. Are there any questions? Otherwise, we'll close.
First and foremost, the most commonly used terms and in hospitals are two big areas to work, which overall describes the hospital's image. That is, one is the management or operational part, other are the clinical departments. I think I am relatively okay with. Secondly, most of the presentation were diagnostic or radiological based. It itself proves that we are still driven by the data, because the data were only available for presently. The buzzword is for the radiology and diagnostic. Integration amongst the hospital between the management clinical is a far lost issue. It is now a kind of primitive thing from my side. Thirdly, the term used as an operation. Sir used, sorry, I don't know the name of the distinguished speaker sitting third from the right, from the left of me. Yeah. Sir has used the term perioperative care. Sir, can you specify perioperative care? Just sir, one word answer. Whether it was for clinical or non-clinical.
Well, I'm not from the medical background, but what I can say is that for
that's okay with me. Yeah, that's okay with me.
Okay, fine.
Now, being an anesthesiologist, I am a professor and HOD at a government institute of the Department of Anesthesiology and Critical Care Medicine, and I am still able to see not much advancement in these two areas, which are one of the most important areas, wherein the lots of the logistics, information, billing, issues, financing, and resourcing, locating, relocating, admissions, gaps, availability, all these are the issue. Just to say, and last but not the least, you are such a distinguished speaker. Sir said he has been in Dubai with the most of the, and was paralyzed to see the structure there. Presently, where the India's position vis-a-vis to in this AI in the health care is holding in the world. Thank you very much.
Okay, I'll probably just say that in India's position, I will just probably mention, if I was to talk about you mentioned about radiation and, how do you try and make sure that there's some improvement. That's the understanding I got about the question. But I'm just saying that India's position is, we are at a very interesting position. We are the data capital of the world. We are the disease capital of the world. But we've not really captured it very well. And I'm just reminded of the time 7-8 years ago when, even in Europe, in Amsterdam, in one of the conferences I was attending, there were radiologists who said that 80% of the accuracy is already there at AI in radiology. That time, 7 years ago. But the remaining 15-20% is so wrong, which they're basically coming up with, that they're not using it. So it's about training the data, training it well to making it even more useful, even more actually, in some ways effective for your own context. So that's what we in India need to do. We should try and make sure that we can use the data well and really leverage it to our context. So that's all I'll probably say. But if anybody...
India is the new oil field. If data is the oil, absolutely. India is the new oil field.
Absolutely. India is the new oil field. Now Middle East is suffering, whatever.
Sir, any new innovation in the field of the critical care medicine, anesthesiology, logistics for the operation theatre and scheduling?
So we can take it offline. I think there's a lot of
Yeah, we'll take it on a chai pe charcha after the tea break.
ठीक है, thank you,
CDS से हो रहा है, काफी कुछ clinical decisions.
Coffee पे conversation.
Yeah.
So I think.
Yeah, please.
Good afternoon. First of all, compliments for a wonderful talk by everyone. It was actually very enlightening. I'm from the government service. I'm from the Army. I head the digital health division in the Armed Forces Medical Services. Just a couple of points, and that's something which we are already trying to highlight. I've, in fact, written an editorial on this. When we are talking about diagnostic capabilities of AI in radiology is one example which was just given. It's very important to understand, you see, that medicine is not a very objective science. It's very important to understand there is a coding creep, there's a diagnostic creep, and the disease patterns change. For example, I'll give you, suppose AI was something which happened around a couple of 100 years ago, and the standard treatment for malaria was letting out blood. We would have never discovered an alternate. So it's very important to understand that unless the human is in the loop, I somehow start getting an impression that the human is not required. As we are saying, the human can do something else. It's no. What does happen is the disease patterns changed. COVID is a very recent example. It's been just, 4 years back that we had a new disease and a new pattern and a new diagnostic findings on X-ray if the CT scans were not interpreted by a human. Unfortunately, when the doctors of today are trained using AI, they lose the art of diagnosing per se fundamentally. You have to understand that's a very serious point. When it comes to healthcare, if you are not able to diagnose because of your cognitive abilities and you depend on AI, do you expect them to solve a problem which is not yet come up? Or will you also depend on AI for that? Now, who will verify? Who will be the golden parameter to solve? Like wherever you do a lab test, you have one golden parameter which says this is the gold standard, and then you have an observation. So when you have an observation which is a gold standard, or which is AI, how do we know what is the truth?
So there's a concept called as, I think you should read it on the internet in greater details. Human in the loop, HITL.
I know about HIL.
So there is no AI without human. I think it's a wrong misnomer or concept that, either it is going to replace. I think how we analyze and utilize AI is completely dependent on humans. AI is being fed by human brains. And I think the interpretation, as I said, it's why there's so much of work on diagnostics, or as Sir asked, is radiology, because that's the volume which you get. So for every one patient, if you have 10 tests, obviously the data will be 1 versus 10. So hence diagnostic AI is far advanced than second is monitoring, because the vitals are monitored 24 hours. And then so on and so forth. As the volume of any healthcare operation will increase, so will be the AI predictability and accuracy, and that's how I would like to say.
As of the data fed to it, I absolutely agree. My point is what happens when the disease pattern changes. I don't think the answer is very evident, but then that is a thing which we all need to keep in mind as doctors.
Totally, and I think I can only say that unless you have people, process and technology working together, you won't get the right results. So it's about augmenting doctors, making it better. The technology has to evolve, and we have to continue to improve it together. That's the objective. But we can't be without technology also, having a blind eye to it. There is technology improving.
AI tools on AMS now, iBars, etc. I think smell the coffee, not just this one. What's available on the internet, and you will see there are a lot of even, as I mentioned, your diagnostic AI tools. So as Sir, what you rightly asked, CDSS has been there for ages. Now even your up-to-dates, Alzheimer's, SIMS, everything is fueled by AI. They are not only now page-based or app-based or just a digital pop-up. I've got medication tools. As I barcode it and give it, it will actually prompt me with the patient history. It's so well integrated where you cannot fathom the depth it will go to. That's all I'd like to say. Thank you all.
Totally. Just one point I'd like to say, that 1 in a million people used to have a lifestyle problem 100 years ago. Now 1 in 2 people have. So the volume is significant. We talked about radiology cases. If you look at, today, there's a doctor who gets sued in the US versus, somebody who's considered a demigod, is 17 minutes. They can spend that much time. India, you can't afford that. Imagine how much time you can spend with one patient. Unless you have technology supplementing it, they can't do anything. So that's all I'll say. Thank you so much for the time. I know we've exceeded a little time.
Thank you. Thank you, Sumit Puri. Thank you so much for the wonderful session. I just wanted to share 2 things on this. With 140 crore plus population in this country, we still attend the patient faster than anywhere in this world. That's something we should give the clap to our own people, the doctors and the nurses and the healthcare people anyone who coming to the emergency, we attend at least within 2 minutes. If not 1 minute, but within 2 minutes. But my friend in Canada, with the stomach pain, severe stomach pain, it took 1 hour 15 minutes for him to someone to attend. After attending, he said, doctor said, we'll come back to you. You please wait. This is not something urgent. So with the pain, not even a painkiller, because there you don't even get a tablet for a painkiller without a prescription. So we should give Bharat or India, whatever you call it, a big salute that the healthcare people, those who are sitting here, give a clap to yourself that you've been attending the patients. So this goes from the peon, the person who taking to the helper, to the doctor, so which covers the nurses and each and everyone. So having said that, there is one thing which we still lacking in this medical healthcare is discharge summary. One patient, it takes 2.5 hours. By the time the doctor comes and says you have been discharged, but he gets out of the hospital after 2.5 hours. We need to change that. Because 2.5 hours, he's still in the bed, he's discharged, go to make the payment, and after that the bed has to be cleaned and everything, the second patient has to come. So this is something the healthcare sector has to focus, how to reduce the timing of the discharge. Because after the discharge of 10 days or 7 days, the patient wants to get out of the hospital and go to home. Home is home, whatever you may say. So that's something which we all need to look at and work on it. Thank you very much. I request the chairman to present the mementos to the distinguished speakers. First to Mr. Lalit Arora. Give a big hand, ladies and gentlemen. Professor Praveen, CIU Amrita Hospital. Oh, he didn't come. Oh, already. Oh, Dr. Suraj Srivastava, CEO SODL Service of Diagnostic and Laboratory. Dr. Samir Singh, Mr. Raj Sehgal, Dr. Vishal, ladies and gentlemen, put a hand together for a young student, Tushar from the Holy Family College of Nursing. A young student trying to make his career in the healthcare industry. Come, let's have a look. So let's have the next panel discussion. After that, we'll have a tea break. So I request Dr. Sunil Khetrapal, Director, Association of Healthcare Providers of India, to please come on the stage to chair this session. Dr. Saurav Datta, Chief Technology Officer, ESIC. Dr. Samir Singh, Group Medical Director, CK Birla Healthcare. Dr. Mahin Azad, CEO, Medical Director, Umkal Hospital. Ramurthy Sharma, Medical Superintendent, Sharda Hospital. And Rakesh Bhatia, Senior Business Development Advisor, Association of India for Medical Device. May I request all of you to please come on the stage. And directly I request the chairman to start the session. Thank you.
Thank you, Mr. Shashidharanji. Thank you once again for the opportunity. I was here last year for the same event. This is the third edition. And one thing, this is the last session of the day. And earlier 3 sessions, there were deliberations on AI. So, all artificial intelligence. But this session is very important because we are not going to talk on AI. We are going to talk on human intelligence, not on artificial intelligence. Human intelligence, the governance, the leadership, and the ethics. So I would request Mr. Shashidharan to please call the audience back so that we can at least run this session. It doesn't look nice to run the session without the audience. I think the last session should be given the equal importance and equal respect by the audience. सुमित पुरी जी आइए आगे आइए बैठिए आपको जाने नहीं देंगे हम हमने आपका सेशन सुना है Thank you very much. So it's a great pleasure and honor to welcome you to this session on leading with ethics, regulation, governance, and responsible innovation in healthcare. As I mentioned that since morning we've been talking on artificial intelligence. Now we are going to talk on human intelligence, the leadership, the governance, and the ethics. So now we are living in a time where healthcare is being rapidly reshaped by digital technologies, AI, and the data-driven innovation. So these advancements are enabling, of course, better diagnosis, improved outcomes, and greater efficiency. The operational efficiency is improved. But they also bring critical questions around the ethics, the trust, and the accountability. This is very important. And today, the role of healthcare leaders, I have a mixed group of healthcare leaders here from both public and private. And the role of healthcare leaders, especially the medical directors, so I will not exclude the CIOs or the CTOs, the role is evolving. It is no longer just about the clinical excellence, but about building a future-ready system. See, the clinical medical directors, the medical superintendents, the clinicians, they focus on clinical excellence. But then we need to think of something beyond that, beyond the clinical excellence. That is future-ready. How do we create a future-ready system? And as we adopt emerging technologies, we must ask ourselves, most important question, how do we ensure ethical leadership in this AI-driven world, number one. Number two, how do we navigate the regulatory complexities without slowing the innovation without inhibiting the speed of innovation. And how do we protect patient data, privacy, and consent in an increasingly connected ecosystem? So at the same time, we must strike a careful balance between clinical outcomes. So that balance has to be maintained between the clinical outcome, cost efficiency, and ethical responsibility. Because technology should enhance care. As we are talking about AI, you know, technology is an enabler. Technology is an enabler. Technology is it enhances care, not compromise trust. Without compromising the trust, how technology should enhance the care, right? Now, equally important in the whole ecosystem is the strong governance you need. These are all people who are from governance, from the leadership. And the governance framework that guide responsible innovation and for preparing our healthcare workforce to adopt these changes with confidence and integrity. This is very important. So ultimately, innovation in healthcare remain grounded in one core principle. The core principle is doing right for the patient. I always talk of the patient. I always keep the patient at the center. Patient should be the top priority. Patient should be on the top of your mind. Always. Whatever we are discussing here, whatever we are doing here, me being a doctor and have been an administrator now into policy, you know, with working in policy advocacy. So I think we must always think of the patient. Patient is the most important stakeholder in the whole ecosystem of healthcare. Now, with this, I look forward to hearing valuable insights from our esteemed panelists as we explore how to lead healthcare transformation with ethics. I think you know, earlier we had 6, 7 panelists, but slowly we are now reduced to 4 panelists. So we have a jolly time we can spend. We have full 1 hour, though the session is running late, but we will take full 1 hour if the organizer allows. I already spent some time. So I think we have Dr. Saurabh Datta with us. Yeah, Dr. Saurabh Datta. Okay, good. Dr. Saurabh Datta, you know, he's the Chief Transformation Officer, right? CTO is Transformation Officer? Technology Officer. Okay. Chief Technology Officer at ESIC. You know, ESIC, we all know that it's a public healthcare system. It's a very vast healthcare system. And he is the Chief Technology Officer. So I think the most valid question which I should ask him is, how can the large public healthcare system, Dr. Saurabh, how can the large public healthcare system like ESIC balance the digital transformation with patient data privacy and cyber security, and while also ensuring the compliance with DPDP Act? So, question to you.
Hello. Thank you for the question. Privileged to be here and sharing my thoughts with you. So, from a government body, as we have the largest number of hospitals under us, and we also have the largest number of medical colleges, government-run medical colleges in India. So, from any digital transformation perspective, it's very important that we should have the security built in the system and not as an afterthought. So that is very important when we do any transformation of any systems that we have. Now, we have talked about a number of things today in terms of security, but I'm really appalled to see the level of security consciousness amongst ourselves, right? So, in fact, we even saw that one lecture back, we saw that some patient data was shown to us. In fact, the patient name was also written there. So those kind of things should be totally avoided, right? So anonymous data has to be used. So we have to be very careful right to the down below level that what kind of security, what kind of ethics we want to run. We are uploading documents on a public third-party system, for example, Google Docs. we are using third-party email services, right? So we are sending critical information. Remember that these informations are all read. They're all read. They're all analyzed.
Okay.
They're all analyzed. They're all read at the background. So all these third-party systems have to be completely done away with in case of any kind of a sensitive information that we are trying to transmit. From a medical perspective, we are not that conscious about the data that we share. In terms of financial, there are still very tight ring fence in the system in terms of the Indian government, right? From a healthcare, although we have the rules and regulations in place, people are quite lax about sharing what kind of data needs to be shared and what all things. I mean, there are very fine prints in some of the medical services which people don't tend to read, but those are the areas where the data gets shared. I don't want to mention them specifically, but those are the areas that we have to be very careful. Now, security is a state of mind, right? So security, unless you put, no matter how much technology you put in, security is always a state of mind. There's a lot of breaches going on. So, in fact, you saw that some time back, one of the biggest national hospital in NCR, it got breached with sensitive medical information, right? I don't want to name it, but yes, that's the biggest, one of the biggest ransomware attack. Let me be very careful. But again, the amount of data which was lost, people don't realize the sensitivity of that. So medical, if you look at the frauds which are happening, the healthcare frauds are at the top. It's not the financial frauds. It's the healthcare frauds at the top of the iceberg, right? So that's really very, very frightening. Second is that we don't give, in fact, as Indians, we don't even think twice. Somebody asks for an Aadhaar card, le bhai, Aadhaar card le le, right? So nobody thinks twice about it, what data we are sharing, what kind of security systems are there in place. And so these are the things that we need to ensure in going for the next level of healthcare, where your data, like somebody mentioned before, data is the new oil, right? So healthcare data is the new oil. Data was always a new oil. So that we saw in one of these escapades back when the election happened in US, right? So we saw that the data was the new oil, and then you have the healthcare data as the latest oil. So what is going to happen is that if you look at the foreign systems who are using India in getting their models trained, all the top big tech companies are giving you for free. For what? They're getting your data. So and after some time, they're going to turn the switch off. And then, because your critical thinking is going off, you are trying to analyze, say, a 20-page report and concising into 3 lines, right? So those kind of capabilities which are already there, and you're getting used to it. So after a certain point in time, you will be liable to pay. You will sell everything and you pay for that services, right? So that is what is going to happen. So unless we are very cautious right now as what we are sharing, we are uploading n number of data into any of the AI systems that we have. We don't know where the data is going. We really don't know where the data is going, who is getting output from there. In fact, one of the recent confidential data in our national level parliament committee was out. So those kind of things, we have to be very, very careful as to who's loading what, because at the end of the day, it is our data. And we have to be very careful. So in terms of ethics, the ground level people has to be sensitized. We are coming up, but we are at a very slow level. The security consciousness in our this kind of a population is very mixed, and they don't have that kind of a sense, yeah, this should not be shared or this should be shared. That thin line is very, very critical. Second, from an ethics perspective, we have to be sure what we are sharing. For example, the MRI or the simple X-ray data that we use to train the system, right? It's basically image processing, simple image processing, or the OCT data from the ophthalmology. You take the OCT, the optical computer tomography, which can be used to 99% accuracy as to predict the diabetic retinopathy, right? So those are the kind of things which are seeing, but those are getting trained using our data. And those are not anonymized to the level which is required. So anonymizing of data is of primary importance. We have technologies coming in which will anonymize data, but again, that is yet to see. Something known as fully holomorphic encryption is an on-the-fly encryption and anonymizing data, which is yet to come. It's in the future. So these are the things that we are to see. And from a DBDB Act perspective, it's already notified, and it's going to be applicable from next year onwards, which will make everybody liable for any of the data breaches. As a data fiduciary, all the hospitals, they are data fiduciaries, right? So all the data fiduciaries are liable for any of the breaches which will happen, just one way.
Right, absolutely.
So that is very important, and the people should understand that this kind of thing has to be drilled down as an organization kind of a DNA, unless to have this kind of a security in place across the organization. Thank you.
Wonderful, wonderful insight, Dr. Datta. And of course, healthcare data is very, very, very sensitive, and especially with the coming of this DPDP Act, it is actually not very well understood by the healthcare people, about DPDP Act. So we need to be, more, deep diving this Act, try to understand the nuances of the Act so that we protect our data. And healthcare is something, digital transformation is happening, of course, at a very rapid pace, but at the same time, data privacy, data security, cannot be compromised. This. Thank you. And my next question is, Dr. Ram Murthy Sharma is sitting here. He belongs to Sharda Hospital. He is the medical superintendent in Sharda Hospital, which is a, teaching hospital. So, a question to him on the governance models. What are the governance models are needed to ensure the responsible innovation in teaching and multi-specialty hospitals?
Thank you, Dr. Ketpal, for the question. And before I proceed, I would like to thank the Bharat Digital Mission and Mr. Shashidharan for giving me this opportunity. Sharda Hospital is one of the largest private sector hospitals in Delhi NCR. We have about 1,200 beds. It's a super specialty hospital. And we have affiliated medical college, Sharda Medical College, about 250 MBBS seats and 130 MD MS seats. So we have responsibility of teaching, training, medical research in our hospital, and clinical care for teaching our students. I'm the medical superintendent of Sharda Hospital. When I told my father-in-law that I become medical superintendent, so he's also a doctor. You were telling me your own experience. He said, in our time, medical students used to roam around the hospital with a stick in the hand, literally. And he will use the stick to punish the people on the spot if he notice somebody not doing things in the right way. Then he asked me, do you also go around the hospital with a stick in your hand? I said, no, now time has changed. So that's the traditional way of healthcare leadership, managing the hospitals. So that was very traditional, orthodox way of managing the hospital, slow to adapt, more hierarchical. But now the things have changed. Now we focus more on e-governance, digital governance. So that is the buzzword nowadays, and the reason is obvious for that. We have large number of patients in the hospital, huge amount of data in the hospital, which we can't manage otherwise. So it's a mandatory requirement now, e-governance. So we had about the Akhil HIS-based system on which we are doing all our admission, discharge, discharge slip, the Akhil-based HIS system. But doctors are resistant to do the typing work. They said that doctors, as usual, are always busy in the hospital. They said, we cannot type. There is no time to type on the system. So then we acquired something called Presco-based solution from Neural Bits. The Presco is easier. Our doctors, nurses move around with a tablet in their hand. They're given the Samsung tablets. They write with a cursor. They hold the tablet and then they write. So all the IPD in the hospital in the Presco system. We don't make any paper files. So maybe one of the first hospital to turn paperless in Delhi NCR. It's easier to transfer the file from one department to another department. Earlier it was a common problem, the file being brought to me for some kind of checking the file, then file will get lost. And then they tell me, sir, file has got lost. It's a very common thing earlier to happen. But now file can be easily transferred from, say, from one department to the pharmacy, to the billing, to the MRD. Seamless transfer, I mean, even for onward submission for any kind of TP or anything. So the file transfer has become very easy. So that one part we have done. Another thing we have used, we are using for the quality software called MedBleach to get the quality indicators regarding the hospital infections or any kind of patient complaints, PRM data. So that is called MedBleach software used. So this is a complete transformation from the traditional leadership governance to the e-governance using the various kind of software. Not only that, but we do face some challenges. I'll come a little later to challenges. With this, we generate huge amount of data in the Akil-based system, and Akil and Presco are integrated. We can see all our data from Akil to the Presco. Lab-based data, LIC also integrated, PAXI also integrated. Doctors can see, even if they're not in the hospital, they can see the lab reports, they can see the images from the radiology. Patient get the report on their WhatsApp. So this is a beautiful transformation overall which has happened of the hospital. With this comes the problem of data security. As my co-panelist, Dr. Datta, was just talking about the data security, data leak. We have to be sure about that, and it has happened in one of the biggest hospitals in Delhi, NCR, data leak. We are all aware of this. So we have some kind of solution for taking care of the data. My IT team is still working on it. We must make sure that our data doesn't get leaked, doesn't get breached, and healthcare data can be used for so many things. So another thing, like we try to implement basically the overseeing the ethical committee. Ethical committee, we have to see whatever we are using, the new things coming, maybe the digital transformation, AI-based thing we are using, so that the clinical ethics, the clinical outcomes are ensured, and we must follow the ethical things in the hospital. So the ethical committee to oversee the ethical things are happening. With this come another kind of challenge in the healthcare. Like I can tell you about the AI system. We are using the AI 100 in our lab. And today morning, when I went to see how the AI 100, that sick to play being used, it is there, available for the last almost 6 months, but doctors are not using it usually. Like one of the previous sessions, they were telling it is being procured, but not being used. So these are some of the challenges that we are facing. But innovation, all these things may bring some kind of innovation, but we have to be sure they are patient-centric, ethical, and improve clinical outcome.
Wonderful, yeah.
Not only this, sir, basically the governance regulatory requirement, we are like the ABDM has come from the Government of India, from NHA, Ayushman Bharat Digital Mission. Our HIS, Akil-based system, Presco is aligned with the ABDM. We have got all NIN, that is HFR, HPR ID of all the doctors, healthcare workers, nurses, our paramedics, HFR ID, and ABA ID. All the patients visiting to our hospital, we make ABA ID. Our HIS is integrated with the ABDM. So the data from the hospital is immediately available to government authority, how much we are doing the like ABA-based registration of the hospital. So the data is immediately available to the government setup, sir.
Thank you for your wonderful insight. I would request Mr. Shashidharan or Ranjit ji to, because this tea break was after the session. I think we started the tea break and then session is going on. There are a lot of disturbance happening on that side. So either we run the session or we have the tea break. I think may I request the organizers to please look into it. I think they should have some patience. Anyway, yeah. Thank you, Dr. Ram Murthy. And my next question is to Dr. Samir Singh was there for the previous session also. So he's the lucky guy to be there in all the sessions. Or
3 of them at least. And
so he's omnipresent.
Equally the heaviest weight who has to bear all the lights without the AC.
Pardon?
Equally the heaviest one who has to bear all the strobe lights minus the AC. So I'm the one who's subjected
minus
to
AC.
this one. Yeah.
Absolutely. So we are the anyway victims. Anyway, Dr. Samir, you know, you are the Group Medical Director, CK Birla Healthcare. And how can the private healthcare institution balance the clinical excellence, cost, efficiency, and ethical responsibility? Because in my opening remarks, I mentioned maintaining a balance is important. So please.
Sir, I think you very well covered it up. So I will say, sir, out of 3 components, 2 goes hand in hand, it is needless to say, which is, I think, ethical governance and clinical excellence. These 2 have to go hand in hand, otherwise one could not excel.
Right.
I think that is, everybody in this room would agree to this. So I think if you wish to achieve clinical excellence, there is no shortcut.
Absolutely.
So ethical consideration is very important. Now with respect to versus cost efficiency, I think that is some code which a lot of hospitals have started to crack. If you deliver good clinical excellence, cost efficiency comes up with or without volume. So I'll give examples of my own hospital, CK Birla Hospitals. We are small format hospitals, 40 beds, 70 beds. But one of my hospitals does the highest number of hip replacement surgeries in Delhi NCR.
All right.
All right. So my TKR, bilateral TKR, average length of stay, you admit the patient today morning, they are out tomorrow night before 12. Now this is not possible if I don't have my ethical consideration in place that, you know, another day is going to charge me another bill, because I also understand another day, the third day is going to go to another patient. That's a better business sensibility.
Absolutely.
One.
Yes.
Second is I've developed protocols based on NHS, etc., where I'm able to manage, epidural with cerebral agree, epidural with morphine, and ensure the patient stands up the first night itself, walks 5 steps. There is a video onto it. So I think with that, I've been able to manage my cost implications also, and we probably have the highest RPOP in healthcare industry in that hospital in India. It is 1,35,000 per patient per occupied bed per day. My next player will be in 5 digits, not in 6 digits.
All right.
So that's the amount of, because the efficiencies, if it's a small compact hospital, and this is not possible if I don't breathe upon the the clinical team's neck on my clinical outputs. So we have a care pathway for every surgery. So it works like a 80% of work is surgical work. So it works like a machine that, okay, this is the time the patient has to come, this is how it will operate upon, this is the time the patient needs to go out. With surgery, it is predictable. With medicine, it will be slightly challenging. I have an advantage of 80% surgical cases. So I've been able to do that, and that's only because we've been able to balance ethics and clinical excellence on one side, and cost efficiencies does follow later.
Wonderful, wonderful. I think that's very good. Thank you for your wonderful answer. And now my next question is to Mr. Rakesh Bhatia. He's a Senior Business Development Advisor, IMED. He's from the medical device industry. He's, from your industry perspective, medical device industry perspective, what are the biggest regulatory hurdles? There are always challenges. Regulatory challenges are always there in medical device industry. So in bringing these innovative technologies to market in India, what are the regulatory challenges you are facing in medical device?
Thank you, Dr. Ketrapal, for the question. And also I thank Bharat Digital organizers for inviting us on a platform where all the healthcare service providers are there. But of course, we are the associates who are facilitating and providers of the gadgets and equipment, which helps the caregiver to serve the center of our universe, which is the patient. So coming to the question, the regulatory hurdles, first of all, primarily we should consider it that the regulations are of course very important, because healthcare is most critical as a domain. So regulations have to be there, and the stakeholders must very consciously and responsibly use them, comply to them. So it's our duty to ensure that whatever is being done is, of course, ethical way and as per the norms defined for the industry. So when I talk about a medical equipment, let's say, so we are the second line of support, because first line is the clinicians who are already having defined what is the actions they are going to take as per the patient's conditions. And then on the second level, we are the providers which assist them to take their understanding and resolve the issue, whatever they are attending to. So now in the current situation, when we are talking about the digital environment, so all the information which is shared right now, data is the primary thing of concern, which is very important not only for the privacy assurance, because it is relevant to a particular identity. And that's what Dr. Saab shared, if on a public forum something is to be demonstrated or shown, the privacy of the individual or the subject should be, of course, masked. So these are certain things marked. And accordingly, DPDP Act, which is like Data Protection Act, is also there, because now software is also being treated as a medical device. So regulations are, of course, coming for that also. And from the industry point of view, the innovation starts with the demand. So we identify what are the demands, what are the asks of the service providers, caregivers, and then we work together with them using the technology or our engineering software or whatever hardware or software support which is required to help them achieve that their target. And secondly, we should also ensure that being the primary responsible for the handling of the data, the devices should have predefined norms and security measures which should protect and help them to do their work in a better manner. So that's what I would understand from the industry perspective.
Great. Thank you. Thank you, Rakesh ji. And again, I'll have one more question for each one of you quickly, because the audience is also getting restless since morning. They've been here. And again, my question is to Dr. Saurabh Datta. Yes. What are the key regulatory and infrastructure challenges you are facing in implementing the AI-driven healthcare solutions, especially to scale up in the government sector?
Yeah, thank you for the question. That's a very important question. What are the key regulatory challenges that is being faced while implementing AI solutions within the medical sector and especially in the hospitals that we run? So primarily the government framework is kind of not very precise as to how the regulatory is quite lax in certain areas, and this needs to be tightened up from an AI governance perspective. It's all evolving at the moment. Most of the companies already have an AI policy. In fact, Government of India has also come out with an AI policy.
Right.
But again, that is quite broad in nature. It has to be specific. And because the major problem with AI is that any implementation of AI, you need to have a model, right? And in order to train that model, you need to have data. Now, where do you get this data?
Right.
The data is a production data. Now, nobody wants to share a production data. So this is where the main fallacy comes in, right? The main challenge comes in, that you want to train your model, but you don't have the right data to train it. So you do an anonymized data, or a kind of a sample data, or a data which is not in line with the model that you are training. So there where the inefficiencies come in, and then that's the biggest problem. So while we are saying that we have a glut of data in the market, at the same time we don't have any data for training the actual models.
Absolutely.
So that's the biggest problem. Like I mentioned, I mentioned before also, that why the foreign companies, the chat GPTs and the Geminis and the Claude, so they are giving us for free. So if you look at their business model, they're charging roughly $200 per year, and they're giving us for free.
Okay.
$200 per year is a big amount of revenue for them. And why they're running so much of services of all the data centers that they're running? Why they're running it for free for us? You have to look into it. So this is one of the biggest
interest.
Yeah, it's a very interesting thing. That why are we, and we are doing it openly. We are doing it very open-heartedly. We are sharing the data with them.
We have to be very cautious, I think.
We have to be very cautious. Again and again, I'm repeating it. It's a very important thing that people have to be very careful of what we are sharing on the internet, public internet. And at the same time, from a regulatory perspective, we need to tighten our the policies. There are 3 or 4 policies which apply for the entire AI perspective. So we have the IT Act. IT Act needs to be tightened. It's quite old, obsolete. So also we need to tighten the AI policy, which is quite generic. It has been about 3 years back. It has been launched. Again, we have the DBTP Act coming in. So all those three lining up together will give you the actual framework for the AI governance within the healthcare sector. So it has to be specific. It has to be separate for the financial sector, healthcare sector, education, everywhere, defense, everywhere it has to be separate. So for example, recently the attack on Venezuela was done using AI, right? The selection of targets was done using AI. It was Claude was used. So when again they said that no, because these people, the Claude people, right? So they are against use of AI in defense systems. So they had said that we will not be giving you this for other military operations. Oh. So there was a big fight between them. So again, there's an ethics barrier which is coming in. So
ethical
again,
considerations.
it's a big topic. So
yeah, Dr. Ramamurthy, just a quick question to you. You are, in a teaching institute, and how can you prepare healthcare professionals for ethical challenges in digital healthcare? You need to educate them. You need to prepare them to face this ethical challenges.
Thank you, sir, for the ethical challenges in the healthcare. Basically, whatever now we are switched over to, as I said, to e-governance. We use a lot of e-based solution like Presco system, Akhil-based system. So first challenge we face the adaptation by the healthcare workers, doctors, nurses. They are not used to adapting this kind of solutions, software solutions. I remember about in 2002, 2001, I was in Bangalore that time, and HIS just come. All doctors said, no, we cannot use the HIS. What is the HIS? We are not used to HIS. Then it became mandatory. Now, of course, we all are using HIS. So first is, no, we cannot do this. Then about a year back, when we started using Presco-based solution, and many of the doctors, especially senior doctors are find very difficult to change. Maybe they become rigid with the passage of time. They find very difficult. They say we cannot use Presco. I said, why we can't use Presco-based solution? If you write anything once in Presco, it remains forever there. The digital signature, what we call, it can't be raised. Paper-based case file, you can change the case file, you can change whatever you've done in the past. So in the case of some complication, patient puts up the complaint, probably it was possible to change the file. But in a digital platform like Presco, you can't do that. The digital signature are there forever. So healthcare worker needs to be more accountable, more accurate, and the integrity, question of integrity. You have to do everything right for the patient point of view, because you can't change anything whatever goes in the digital platform. So that's a challenge I was facing. So younger generation still is able to adapt, able to change the things, but the senior still are refusing, we cannot use Presco. That is one challenge we are facing, sir. Second ethical issue we are facing, as Dr. Datta very rightly mentioned, the role of AI. Today morning I went to my lab and saw the AI 100 being used. So my pathologist being said, sir, AI gives a wrong report. They are using for hematology to see the slides, to screen the slide basically. Once the AI screens the slide, flags something in the slide, then it goes to the pathologist for further clinical correlation. As you said, AI will not replace the doctor, but there is still role of pathologist. So he sees the slides in detail based on the clinical information available from the patient and then give the final diagnosis. He said, suppose AI gives a wrong diagnosis or misses the slide, then who is responsible? Am I responsible, or the AI is responsible, or the manufacturer who has made the AI machine is responsible? Dr. Datta just now told AI policy. So I was not aware that AI policy in our country, which the government has brought out, but how do we use the AI-based policy is still open to the question. Another example, I can say, the robotic, we are using telemedicine, robots. Nowadays, robots are becoming more and more popular. I know myself, I was doing one of the case in very tertiary care hospital, robot was used, I won't name the robot, and surgeon was sitting on a console. Suddenly patient is bleeding, and the rupture of the major vessel, it was major bleed inside the abdomen. We have to stop immediately the robotic surgery, and with a great difficulty, we could rescue the patient. So this kind of patient, suppose patient has some major complication or patient dies because of robotic surgery, or who is at fault? Robot is at fault or surgeon is at fault? Difficult to say. I leave the question to the expert technocrats and its expert here, and this kind of questions. So these are the ethical challenges you are facing in the healthcare setup, sir.
Thank you, thank you. So I'll move to Dr. Sameer Singh again. As a quick question, we have 3 minutes left. So one minute answer from each of you, Dr. Sameer and Rakesh. Dr. Sameer, what framework you will follow to ensure that responsible use of AI tools and in patient care?
Sure, sir. So I'll keep it crisp. I evaluate a lot of technologies, especially the medical devices one. How it makes me helps me make the decision is AI giving a better outcome to the patient? So we spent about 50% more when you're buying a radiation oncology equipment because it will change my treatment plan for at least 30% of patients. If I don't use it, 30% will probably get a slightly not so correct treatment. One. Second is we are small format hospitals. So if AI helps me manage my manpower number in terms of patient interaction, patient end-to-end communication and less errors, that's the technology I want to go for. So these are the two considerations.
Wonderful. Very crisp answer. Thank you so much. Rakesh, last question to you. And, how to, we talk of, collaborating with the industry. How can we, the healthcare providers, collaborate with the industry, to ensure the ethical adoption of devices and technologies? It's very important that you cannot work in silo these days. Correct. Even to follow the ethical regulation, you need to collaborate. So how do you?
So primarily from the industry perspective, the information that we already have about the market, we are almost 80% dependent on the import of medical devices. So government is proactively doing a lot of efforts to promote Make in India, Innovate in India, R&D in India. And a lot of our prime institutions, students, brilliant students, they are all working to devise many products or devices which are actually going to replace as a indigenous replacement for the import, right? So, but of course, due to regulatory requirements, we have to comply with the clinical trials and all those things. So, from the industry or innovation side, I would suggest healthcare service providers, although the ask is from their side only and we align the innovation with the clinical procedures, we need their support to help us with the trials proactively. Although government has already put in place, like there are institutions like ICMR, they have schemes which are like, for example, MedTech Mitra is one of the schemes. Yeah, it is a joint scheme between the, it's a scheme jointly promoted by CDSO, ICMR, and I think Niti Aayog. 3 organizations are collaboratively supporting the innovators so that once they make a device that has to be validated as per the regulatory norms, standards, and then its clinical trials and validations are also done. So this kind of hand-holding is also we will request from the private service providers because huge lot of patients are getting attention from the private caregivers. Right?
Thank you, Rakeshji, for a wonderful insight, and thank you to all our distinguished panelists for sharing such an insightful perspectives. So I'll just end the session here with my last comment. The future of healthcare will not be defined by technology alone. So please listen that the future of healthcare will not be defined by technology. The future of healthcare is digital, that is true. But it not only by the technology, but by the values, which is very important. Please understand the values with which we use the technology. That is important, not only by the technology. And lastly, as leaders, our responsibility is very clear. Please innovate boldly. Embrace AI boldly. You innovate. Embrace the technology. But govern it wisely. Be very judicious. And govern it wisely. And always put the patient at the center of every decision. When we try to take some important decision on AI, technology, cybersecurity, sometimes we forget the patient. Patient should always be there at the back of your mind. Whatever decision you are taking, please keep patient at the center. So with this comments, I end the session here. Thank you very much. Thank you.
जागो भी आया